Doctors have read it. What is the most bizarre issue you've seen a patient trying to hide or mask? A patient came in with chest pain, said they'd fallen and hit their chest on a table. X-ray was performed to evaluate for a rib fracture or collapsed lung. The X-ray instead showed a long metallic foreign body in the left chest, within the heart. When questioned further, the patient admitted to lying and that they'd actually shot themselves in the chest with a nail gun. The wound was not bleeding nor really noticeable. They were taken to the operating room and did quite well after open heart surgery. Story 2. Not sure if this counts as hiding, but a patient we recently had tried to play off a rampant staph infection as just some leg swelling. Turns out what he meant by that was he had a horrible infection in and around his genitals, something known as Fournier's gangrene. Do yourself a favor and don't Google that. The swelling had gotten so bad that his chicken had literally inverted. He later told us that he had to pee with a 5-gallon bucket held up to his crotch because he no longer had any idea where the pee was going to go. Edit. Since so many people are asking what happened, he went to emergency surgery within hours, which is likely to be the first of many. Only way to get rid of an infection like that is debridement in the OR plus a crap ton of antibiotics. Somehow this guy had no systemic signs of infection, fever, low blood pressure, etc. So thankfully he should pull through. Last I heard, he was likely to lose one of his testicles, but I don't believe they were going to have to remove his whole chicken. I know it's fun to talk about how gross this stuff is, but it's a V. Guys, do yourself a favor, if stuff starts, inverting, it's probably not some routine leg swelling. Ugh, I'm uncomfortable. Story 3. My aunt is a family doctor, so patients come to her with symptoms and she directs them towards a specialist based on her diagnosis. One day, an elderly husband and wife came into her office, and when asked why they had come in, the wife responded, "His foot has been smelling for a while, and I finally convinced him to come have it looked at." My aunt, not hard of smelling, concurred that his foot stunk. She asked him to remove his shoe and sock. When he removed his sock, the bone from his big toe fell out of his toe and onto the ground. Turned out he had a very bad case of gangrene that had eaten away the flesh of his toe. He knew something was wrong but was stubborn and didn't get it checked sooner. And my big toe hurts now after typing this. Oh, I got a feeling these are all going to be very gross. Story 4. I once saw a high school-aged kid come in with a dinner candle stuck in his rectum. He reportedly was using it to reach an itch. Apparently the itch was in his spleen because that thing was deep. Mom told me the story and how she had previously asked him to not itch himself with other things of hers. I didn't ask for any more details. I honestly think she believed that it was just really itchy. By the way, ITT prediction, rectal foreign body stories. Lots of them. Story 5. My mother, the medical professional of our family, had a 13-year-old girl who was 9 months pregnant, in the midst of labor, dilated to 10 centimeters and crowning in the emergency triage, swearing until she was black and blue that she was a virgin and that nobody knew what they were talking about. Her mother stood on the sidelines, causing a commotion, demanding a real doctor make an appearance. Let's just say when the twins made an appearance 10 minutes later, they were all singing a different tune. By the way, guys, you see I finally learned how to say triage. Let's go! Story 6. A case of teenage pregnancy where Madam Mama was present. Patient presented with amenorrhea and fatigue initially. Patient became visibly annoyed when the first test suggested is a pregnancy test. Patient and mother insisted that she never had any sort of intercourse. Angrily, if I may add, even when the test results turned back as positive. No, you quack! I'm telling you, she ain't never had no relations like that! Story 7. Internal medicine ward outside of New York City. 55-year-old lady was a mute in the ED. Noted poor historian, but severely constipated, severe abdominal pain, needed rectal disimpaction, and more than just an acute workup, so gets admitted reluctantly to surgery. Next morning on rounds, she is talking a mile a minute, full of detail about her diet and symptoms and family, etc. Afternoon, back to mute, and back to abdominal pain and constipation. 2 more days, same pattern. Team is stumped. She is blown away that we can't figure out what is wrong with her, and we feel the same way. Labs, imaging, consult teams, all coming up empty. Strict ins and outs, strict dietary restrictions, everything we can think of. Janitor comes in by chance and is upset he has to change the paper towels. So many goddamn times in this one room. Seems like the whole floor is stealing them from her. Sure enough, PT has been consuming about 2,500 paper towels every 24 hours. Psych team comes for the obligatory consult, and of course, she is mute. How do we get her to talk? one paper towel at a time. I think some poor intern got a paper out of that case. Hope she is doing well somewhere. Story 8. Not a nurse, but my mom works with nurses who have crazy stories. Here's 2 of them, both from ER nurses. A man came into the ER with a birthday candle and his chicken. He had stuck it in there to surprise his girlfriend on her birthday, but when he lit it, it melted the candle wax stuck to him. This is probably the weirdest one I've ever heard. An old woman came into the ER with a high fever, abdominal pain, dizziness, etc. She's showing signs of toxic shock syndrome, like when you leave a tampon in too long. So the doctor decides to check the woman to make sure nothing got stuck up there. Sure enough, she looks up there and half craps her pants when she sees 2 beady little eyes staring back at her. The doctor begins to pull it out, to which the old woman responds, "Put it back!" Turns out the old woman, well past menopause, had gone to a bad witch doctor to help her get pregnant. Her recommendation, put a now dead turtle up there for a few days and she'd regain the ability to get pregnant. Holy smokes. Both of those stories involved sticking things where they don't belong. I think that's a good lesson. If you're trying to avoid any sort of dangerous situation, just don't shove things in holes, especially live animals, please. Story 9. My cousin told me about a patient who complained about her nipple falling off all the time. She said she tried to glue it back on or use skincare creams to have it stick to her breast. Turns out she had, not sure what stage anymore, probably pretty bad, breast cancer. From what I remember, the tumor got so big that the breast skin was stretched quite a bit. Somehow, that plus friction led to an open, not healing, and oozing wound which extended to her nipple. Well, nobody there understood how she didn't go to a doctor or a hospital earlier. Keep in mind this happened in Germany. She had a job, health insurance, and everything. Story 10. Ooh, I've got one. I had my nose straightened and septum shaved after I broke it like an idiot. I woke up after anesthesia, feeling like the effing man. After about a minute of being awake, I tore out my IV, stood up and started walking out of my room because I was going to walk home, about 3 miles, and finished that one mission in Heroes of Might and Magic 3. I walked past a nurse and she said, "You're bleeding." "Haha, no, I feel amazing," I responded. I keep walking until I get to the elevator and I see my reflection in the metal. My face is bandaged up with blue and black bruising leaking out from under the white fabric. My eyes are bloodshot and I generally just look like crap. No matter. I wake up sometime later, back in my bed with the IV inserted in my other arm and I am strapped to the bed. Turns out I was on a morphine drip. That's why I felt like Superman. My parents start yelling, but I'm like, "What are you talking about?" Turns out I gave myself a very, very bad concussion when I collapsed while waiting for the elevator. On the bright side, that is how I found out painkillers were amazing, and that they would help me survive a year of intense manual labor when I ran away from home. On the downside, I was addicted to painkillers. Story 11. I admitted a guy for pneumonia, which was odd because he was young and strapping. No other medical issues. X-ray didn't look quite right. The pieces just didn't add up, and so I started questioning him more closely. Me. "Do you use any drugs?" Patient. "Drugs? That's disgusting. Nom nom, no freaking druggie. I've never touched a drug in my life." I move on to other questions and suddenly, patient. "Look, doc, I just want you to know I may have used cocaine once or twice years and years ago, but it was just once, and I snorted it though. That wouldn't cause this, right?" Me. How long ago?" Patient. "Like 10 years, 10 years, maybe longer." Me. "It shouldn't be affecting you after this long." Patient. "Okay, it's more like 5. Me. Years?" Patient. Like 5 months ago." This goes on forever until he admits he had just got off a massive binge the day before, where he spent the last 3 days in a hotel room with some loose women, smoking nonstop. He finishes with, "But I don't want you to think I'm some sort of dirty druggie. No, but I do think you're the idiot who lied and was getting treated for pneumonia instead of getting the proper treatment for crack lung, which is what he had. Here's a tip. I genuinely don't care. I'm not your mama, your spouse, or your priest. Don't waste my time and endanger your health spewing bullcrap. Whatever horrible twisted thing you think is too shameful to talk about, I promise you, I've seen worse." Story 12. Obligatory, not a doctor. On Thanksgiving, I had a pain almost literally in my butt, but more toward my perineum. Ingrown hair/abscess type thing. Went to the ER since it was a holiday and I could hardly sit. When they asked what was the issue and where it was located, I said, "In a sensitive area." When they pressed further, I said, "My perineum." "Oh," the nurse replied, "your taint." We all had a good laugh and I had my taint lanced. Story 13. Not a doctor, but I'm sure the doctor would tell it. Too long didn't read, had an infection, and had a hands-on experience I won't forget. I was 12 and had an infection in my scrotum and tried to hide it, hoping it would just go away. I was walking funny and it eventually turned purpley. My parents got very worried and spoke to me about why I was walking funny. Finally, I had to show my mom my crazy swollen purple testicle and we went to the doctors the next day. While there, I explained the situation. They needed to do tests, so I was given morphine and so they could ultrasound my nads. There was a super attractive nurse doing the ultrasound too. She got clear jelly all over my balls. It still hurt, but man, if that wasn't one of the first rock-hard erections I ever had, I don't know what was. I was so weirded out by the whole situation. First, I get an infection in my balls, then I'm given morphine, then get jelly slathered all over my balls, then I see one of the prettiest girls in my life and she touches my disgusting morbid sack. I tried desperately hard not to smirk because it still felt kinda good, also being ticklish. But every couple seconds I would giggle and smile, but then a quarter second later it would hurt and be painful. So it was a roller coaster, especially for being so young. It went on like that for at least 5 minutes. Don't really remember what the problem was, but if I recall correctly, I had a bacterial infection, but it cleared right up and I was fine. I think the only lasting effect from that was that woman with short hair are still very attractive to me. Doctor and nurse, if you're reading this, thank you, but holy crap, that was confusing. Story 14. Not a doctor, but a friend is. Patient very hesitant with what was actually up, so went for x-ray. Unmistakable shape of a Barbie doll up his butt. So emergency surgery and it's removed. He comes to and sees his wife at his bedside. He panics and when she goes to the ladies, asks the nurses not to tell her what happened. She comes back in and one of the nurses brings back the crap-smeared Barbie doll in a small plastic bag. Wife glares at him. I fell on it. Story 15. I had a lecturer who told me about a homeless guy who regularly presented to ED claiming stomach pain. He would get an abdomen x-ray which showed a bunch of wire inside his abdomen. He would be added to the next day's emergency theater list, get a hot meal and a bed for the night before hooking it the next morning and self-discharging before surgery. He had purposefully pierced his belly with a wire coat hanger and fed the thing inside himself so he could go around to hospitals and score a free hotel room for the night. This is somewhere with universal healthcare, so even though he was a regular and the hospital staff knew him by name, they couldn't refuse treatment and couldn't force him to have the coat hanger removed either. Story 16. My late dad was a surgeon and, when he was a resident, had a middle-aged male patient come in complaining of pain in the rectum. They examined him and found a vibrator lodged fairly deep. When they asked him how it happened, he looked extremely surprised that it was there, and then explained, I was lying in bed and I was on it and vibrating on the bed near me and it sort of moved on its own. Guess it found its way up my butt and all by itself. Loved hearing emergency room stories from my dad, and it sucks that he's not around to tell them these days. Story 17. Not so much bizarre as clever. I drug tested a patient who should test positive for opiates, as I prescribed them. We do that too. The urine looked totally normal, but the test came back bizarre. Had an insanely high specific gravity. Means there was a lot of stuff dissolved in it. Sample was positive for opiates, but had zero confirmatory metabolites, what your body turns the drug into, in it. Otherwise, test was totally normal. It took me a couple of minutes to figure out how this was possible. The patient was selling their pills instead of taking them and didn't want to get caught. They crushed up the pill and put it into the urine. This made the test positive for opiates, but because it had never gone through their body, the testing machine found no metabolites. I use the case to find the smart med student in a group now. Story 18. When I was in the hospital, there was a homeless man that was beyond drunk. This guy was next level crap. He had 2 doctors, 3 nurses, a cop, and an orderly trying to keep him restrained. He thought he was forming coherent sentences, but the words, "I'm not frickin' drunk," came out several times, along with, "I don't even drink alcohol. It was rainwater." They kept telling him they would sedate him if he wouldn't stop his wild behavior. They couldn't because of his BAL. Every 20 minutes, he would get riled up again and same crap all over again. Eventually, he admitted to alcoholism, and the cop left, and 2 doctors looked after the man. Dude even ripped out his IV. Story 19. Oh God, I don't care if it's going to be buried, I need to tell this story. My uncle is a retired surgeon. One day, an elderly man gets to the ER with the handle of a paintbrush up his butt. We're talking decades ago, In a countryside hospital, sticking things in your butt was a big taboo. Go figure in an old man's mind. So word spreads among the staff, and the doctors and nurses enter the poor man's room pretending to do preliminary checks and ask him why he is there for. By chance, he also had a scratch on his wrist, and that was his answer to everyone. I have this scratch here. I wanted to have it checked. Story 20. It wasn't the patient, but his a-hole relatives. They came into my office to ask me to see this old guy because he had accidentally cut himself and wanted some stitches. I told them I couldn't do any stitching, lack of sterile equipment, but would have been glad to apply some Steri-strips if the wound allowed it, as long as they brought the man in the office. Request denied. They kept insisting I see the man at home. Fine. I loaded up my bag to go check on the old fellow. I found him in his bed, conscious but refusing to talk, with various superficial knife wounds on his stomach and a gigantic hematoma in the process of swelling up on his forehead. I flipped my crap and got the relatives to finally talk. They said the man had fought with his sister and decided to self-harm by repeatedly slamming a hammer on his forehead. He then tried to disembowel himself with the kitchen knife. They didn't call an ambulance because they were ashamed and didn't want to deal with assisting the man in a faraway hospital. I gave them 15 minutes to get their crap together and either call an ambulance or get the man to the hospital themselves. Never knew what became of him. Story 21. Well, I'm a radiographer, and sometimes you see those objects stuck deep inside patients. I've seen a spray can, a screwdriver, a potato, a dildo gone way too far, but the more surprising one was a woman that used a Coke 33 glass bottle as a dildo, and she didn't have enough, so she used another. I guess she felt nothing due to excitement because she pushed the first bottle into her uterus, breaking the cervix by pushing with the second bottle. Story 22. Not a doctor, but when I was working as a med tech in the ER, we had a male patient, 75 years old, come in with an extraordinarily low blood pressure. Think 70/40, and a ton of facial and upper body bruising. He was brought in via EMS after the nurses at his nursing home found him on the floor in his room, where notably there was some blood on the wall. The guy wouldn't talk to us regarding why he was there, but was very talkative in terms of pretty much anything else. Sports, the news, etc. We couldn't for the life of us figure out what happened, since we couldn't find any bleeding internally, his fluid levels were fine, and he had not left the nursing home, so there was nothing available for a high mechanism of injury. We eventually were able to get him talking, after 4 hours, and he confessed that he had wanted to commit self-unalive and had taken the remaining amount of his prescribed nitroglycerin, used for chest pain, lowers your blood pressure rather quickly. Nitro is also the active ingredient in dynamite, but the amount in the pills is minuscule compared to what's in dynamite, and had tried to blow himself up by running into the wall repeatedly. He was a really nice guy that sent a card to us after everything. He was just extremely lonely. Story 23. Sister's friend is a nurse and told the story of a man who came into ED clutching his abdomen and complaining of severe abdominal pain. He was acting suspicious and kept changing his story, symptoms, site of the pain, etc. Sister's friend and a few other nurses suspected something wasn't right, and after maybe an hour or so, he confessed the true cause of his pain. He had inserted a deflated, full-size basketball, note a very cheap one, into his butt and pumped it up. Amazingly, he somehow managed to pump the ball up to the point where it popped inside his butthole. The popping is what had caused his pain, but the kicker was this. He hadn't come to the ED to treat the pain. The basketball was still inside his butt, and after the pop, a combination of pain, presumably swelling, and it still being semi-inflated had meant he was unable to retrieve it himself. She didn't go into detail as to how the basketball was retrieved, but I can't imagine it was pleasant. Oh, that's a whole other kind of deflategate. Story 24. Pregnancy. Patient arrives into ER triage. She is in her early 30s and was complaining of lower abdominal pain and nausea. The British triage nurse, who tells this story the best, says the poor woman was bent over double in her chair. From all accounts, she was a relatively skinny individual. In order to make sure there was no emerging emergency, our triage nurse has a peek at the patients downstairs. She was greeted by a crowning baby. The nurse bolts up and runs into the ER and grabs my attending. "Sir, she's up the duff!" Confused, a brief "who's on first?" exchange ensued before my attending and I ran in, just in time to catch a healthy 8-pound baby. There are several other incidents similar to this, but none so pronounced. Mother denied being pregnant up until the moment her baby girl was on her chest. Story 25. Not a doctor, but watched them with a man while in the ER. Guy walks to the back with a couple of towels on his shoulder. Looks like blood is starting to seep through. Nurse. What happened? She starts to take the towel off. Her face turns from a smile to very serious. Calls over the doctor and others. Guy. I was cutting some branches overhead with a chainsaw. It got caught on one of the branches and came back on my shoulder. By now, there's a crowd around the man and they are getting ready to take him back for surgery. He had basically cut into his chest with a chainsaw. Not life-threatening bad at that point since he walked in. I was in awe, to be honest. I always wondered how he shut that dang thing off before straight unaliving himself. Story 26. Not a doctor, but a corrections officer. Had an inmate complain of pain in his chicken. Took him to the facility hospital where he had screws jammed into his urethra. About 14. They took the screws out and put him on some psych meds. About a week later, he cut his chicken off with a broken mirror and flushed it down the toilet. The chicken was never recovered. Story 27. My best friend's mother is a nurse. Since we've devolved into tell whatever story, one night as a joke, he decides to show her one man, one jar. Hilarious thing to watch with your mom, right? Anyway, this woman deadpans the entire video and follows it up with, "Oh, is that it? Okay." Dumbfounded, we ask what she could have seen that could possibly be grosser than that, right? She proceeds to tell us in detail about a man who stuffed a hamster into a condom, then shoved the rat bag up his butt. The hamster then, out of suffocation, chewed through the condom, clawed its way deep into the rectum where it drowned in a mixture of blood and crap after shredding his colon in a frenzy, like some effed South Park joke. She was part of the team that had to retrieve it. His mom always seemed like the demure housewife, but dang, that lady has seen some crap. Story 28. Not a doctor, but my sister is an organ donation. Their biggest obstacle is people thinking, doctors will let me die and steal my organs. First of all, if you die, your organs are useless. They can take corneas, long bones, ligaments, and sometimes skin from dead bodies, but those aren't rare or in demand. Everything they do to save your organs would also save your life. You need to be brain dead but have a steady heartbeat on a machine that breathes for you to donate organs. Usually, the doctors need to work for hours to save an organ donor, effort that they don't actually make on a non-donor. She's been called to cases where the doctors thought the patient was dead meat. She doesn't get called unless they are brain dead. But the doctors kept working because it was an organ donor. They'd have called a non-donor on arrival and sent them to the morgue. But they kept working and the person was revived and recovered. Recovered fully. If you want everything done to give you a chance, sign your donor card. I signed mine after she told me about that. She signed hers. These doctors will give up on you if they think you are a lost cause. Story 29. I had a patient who, instead of treating her choice to have artificial donor insemination as an empowerment move, had everyone else convinced that he had a deadbeat dad who took off when he was born. She felt that this made her look empowered because she stood up as a single mom. The now school-aged kid knew but was horrible at lying. When I asked him what life was like at home, he said something along the lines of, "Good, just me and my mom. She's a good mom. Pretend dad ran away. There was no real dad, though." Oh, busted. And then donated. Story 30. Nurse here and I'm late to the game. I've seen some crap, but in this story, the patient tried to hide something and I paid for it as well. Was working at a teaching hospital here in NOLA as an agency nurse. As some of my fellow agency nurses can confirm, when the staff nurses find out an agency nurse is coming in, we get the patients that the other nurses don't want to deal with. In essence, the crappiest patients on the floor, literally and figuratively. I got my reports and was making walking rounds with the nurses going off shift. We walked by a patient's room and he wasn't there. Outgoing nurse says he's always going down to smoke and that he's very demanding. He was a homeless patient there for an infected arm from IV drug use. I asked the nurse why was he being allowed to leave the floor regularly with an IV in his arm, and she just shrugged. About an hour later, my patient finally reappears and shuffles into his room. I make a mental note to go in that room next for my assessment after I finished giving another patient their meds. I go to walk in and the door is cracked. I hear snoring, so I'm knocking as I open the door. I say, "Hello, Mr. Addicted? I'm Tattooed Goth Queen, and I'll be your nurse today." He doesn't flinch. I know he's not dead because I could hear him breathing. I place my hand on his arm and gently shake him, and dude comes out of it screaming like a wild bear, waving his arms, cursing, and flings the bag of white powder he's holding right in my face. I hit the code blue button because I'm legit terrified. This dude is freaking the F out, and I look like Frosty the Blowman with an yet unidentified white powder in my hair, on my face, and on the shoulders of my scrubs. The code team runs in with a crash cart, sees me, sees freaking out patient, and grinds to a halt. Someone runs out and calls security, and a big fella of a respiratory therapist pins the dude down. Security runs in and handcuffs him to the bed. Nursing floor manager starts grilling him about the powder, and I hear him start insisting that it's baby powder, and I scared him while he was cleaning up and he threw it on me. That's really the last coherent thought I had. I come to in the ER and get the story from the doc after all the security footage is reviewed. Dude was going downstairs, meeting his supplier, and bringing the goods back upstairs, cutting his supply more with hospital-supplied baby powder that he had been requesting for chafing, going back downstairs and having his customers meet him in the ER parking area. He had passed out after shooting up into his IV in the parking lot, and I came in and scared the heck out of him. He had thrown a nice baggy mix of heroin and baby powder in my face. My husband had to come get me, and I was given a note in case the agency drug tested me in the near future. I also had to give a statement to police. It was simultaneously the best and worst day at work I ever had, and subsequently the last hospital shift I have ever worked. Story 31. Sorry because English is not my first language. I'm a neurologist in Spain. We were brought a patient with an acute stroke in the morning. Asking him about how it happened, he said he had gone out for an early morning jog when he fell down, unable to move the left part of his body. An hour later, a nurse asked him the same question and he gave another different fake answer. It turns out he had woken up early, left his house, and he was having relations with a prostitute when he suffered the stroke. It was this woman who called the ambulance. The tough part was meeting his family. Story 32. I did an internship with a doctor, dermatologist, and she told me that one day a homeless guy came to the hospital with a bandage on his foot and was saying it was painful. The nurses were afraid to take care of him because of the horrible smell and discover what was under the bandage. The dermatologist was called in and she did it herself. When she opened it, the foot of the guy fell off. Apparently, he got an infection and the larva started to eat his foot. Story 33. I used to work psych, and we had this regular patient who we all knew quite well. Schizophrenia, paranoid type. He was always complaining about spider eggs in his brains. One time, upon admission, he complained that his butt was hurting because he sent a rat up there to retrieve a message. Of course, no one believed him, but we have to check anyway. Sure enough, there was a rat tail hanging out of his rectum. Patient's biggest concern was that he get the important message from the rat who was dead, of course, and also nonverbal regardless. Story 34. Oh, I have tons of weird stories. When I was a fourth-year medical student doing a rotation at the Veterans Administration Hospital, the patient came to the emergency room complaining of stomach pain. We did an x-ray which showed 2 toothbrushes in his stomach. He explained to us that he had the sensation that there was something on the back of his throat and used his toothbrush to try to get rid of it and accidentally swallowed the toothbrush. The same thing happened with the second one. We consulted gastroenterology and the toothbrushes were removed via endoscopy. He was admitted to the hospital for observation overnight. The next morning, he complained of stomach pain again. A follow-up x-ray revealed that he had swallowed his entire convenience kit at the hospital, including the small toothbrush, small tube of toothpaste, and even his plastic razor. Needless to say, we called psychiatry for consultation. It turns out this was not the first episode for this guy. He just liked to swallow things. This is like some sort of Penguins of Madagascar bit. Rico, toothbrush! Bleh! Story 35. In the summer, my brother and I used to spend our time in the backyard looking for caterpillars and frogs. Given I was 4 years old and did not know what I was doing, I thought it would be funny to put a caterpillar down my 2-year-old brother's swim trunks. He didn't feel the caterpillar go down his swim trunks, so I didn't get the reaction that I wanted from him. So I just forgot about the whole thing and moved on. Later that day, when my mom was changing his diaper, she screamed and saw all of these spikes in his butt that he must have got from the caterpillar from when he sat down. Turns out he had an allergic reaction to it, and we had to go to the doctor to get all of those spikes out of his butt. Would it be wrong to make a butterfly joke, or is that fine? Story 36. Lady presented multiple times requiring admission for systemic infection, found to be a weird amoebiasis. ID docs were very confused. This was in the middle of a U.S. suburban area. She was drinking her fish tank water to get sick. Morbidly obese lady came into the ED altered and obtunded. Kept responding to Narcan, then getting obtunded again. 3 fentanyl patches eventually found hidden on the undersides of her pendulous breasts. Prostitute with a murder kit, including a large wire garrote, 4 knives, and various poisons in her handbag. And of course, the guy who came in from jail in excited delirium with an uncomfortably large quantity of methamphetamine hidden up his butt. Story 37. Not a doctor, but friend's sister is. 2 people came into A&E one night. Let's call them A and B. A had cuts around their lower back, upper thighs, and in and around their butt. B had cuts and a shard of glass in their face. Upon admission, they didn't say what the cause of these wounds was. It wasn't until they found traces of fecal matter in the second patient's wounds that they said what happened. As it turned out, A had been sitting on a glass table taking a crap while B sat directly beneath to watch A take a crap. The glass table gave way and broke during this. Bit of a bloody crap experience. Story 38. My sister spent several years as an A&E nurse before moving into cardiology. Her best story is the guy who claimed to have been nude gardening. He said he'd slipped, fell, and landed on a marrow, impaling himself via the rectum. This wasn't a small cucumber or courgette, but a bloody massive green marrow. After removal and behind the scenes, one of the doctors chased her and another junior nurse around with it for giggles. She still cries with laughter when telling the story, especially as it had a Tesco price label still stuck on it. That's a supermarket for non-UK readers. There's still so much shoving of the things. Also, I have a feeling I'm still pronouncing so many things wrong, so I do apologize for any illiteracy that's on display. Story 39. Had this dude when I was a medical student while on surgical service, got consulted for priapism. Asked the dude how long he had erection, etc., and he just said, yeah, his chicken hurts, not sure why, blah, blah, blah. Then examined him, and dude's chicken was quite literally a cauliflower of warts. Turns out he had HPV and HIV and didn't take his HAART meds, and this isn't the first time it has happened. Cleared up after starting to take his HAART meds previously. Story 40. NSFL. A hotel I used to work front desk at had a small bar on the side of the lobby, connected to the front desk. On slow evenings, my coworkers and I would chat with guests at the bar. One night we had a lady who was a nurse tell us some stories from work. A very obese lady was admitted to the hospital after she came in with her arms and legs covered in pus-filled sores that were about an inch in diameter and sometimes several inches deep. At first, she said she didn't know where they came from, but after the doctors insisted they weren't natural, she kept making excuses as to where the sores come from. Eventually, she came clean and finally told the truth. She was a prostitute, and some of her clients decided that due to her obesity, they had to make their own holes. Story 41. Patient came in complaining of abdominal pain. Ultrasound revealed a belly full of blood, ruptured spleen. Ran back to surgery, encased spleen in mesh, stabilized. On waking, patient confesses that he was cheating with another man's wife. Man came home, ran patient over with his truck. Patient attempted to walk it off, went home and bled internally for a while, then came to the hospital hours later. Location, Bremerton, Washington. Story 42. This story came from a nurse I was good friends with. She worked at a metro hospital, and this was her most memorable one to date. Couple goes to ER. The lady of said couple comes in complaining of a rash around her colostomy hole, and she is very concerned. They do a few general tests and take a bacteria sample to the lab. When the results came back, our friend had to deliver the news to the couple. Turns out the rash was chlamydia of the colostomy hole. Now I will give you a minute to let all that sink in here. Okay, so this led to the following breakdown of events. It was now discovered that the couple were engaging in relations in her colostomy hole beyond the normal areas of choice. The lady also later checked out to not have said chlamydia of her genital area, therefore leading to the discovery that her man was cheating on her and brought her home a gift from his other lover. Man, some weird crap goes down in the Motor City. Story 43. Not a doctor, but in Afghanistan, our platoon set up a medical clinic for a day with a bunch of our medics at this remote village. We had, I kid you not, 24 males come forward needing cream or antibiotics for some genital infection. Our medics weren't 100% sure what it was, but did the best they could. Talking to our Afghan interpreter later, he said nearly all of the males who had the chicken infections were, you guessed it, goat herders. Oh, by the way, this village had only approximately 100 or so people. Dang near 25% of the population are out banging their goats. Our female medic got a good one too. Some Afghan woman who had given birth 2 weeks prior still had the rotting, infested umbilical cord hanging out. Story 44. RN here, we had a lady come in with severe stomach pain, diarrhea, and a fever for the last couple of days. So I'm asking her all of the routine questions like whereabout is the pain located? Are you on any regular meds? Any other symptoms, etc., etc. Anyway, I ask the usual question. When was your last solid bowel motion? She thinks about it for a while and comes back with, I think about a month? A month? I asked if this was usual for her, and she said, no, I usually poop once every 2 months. She is saying this like it's a normal cycle. The doctor orders an x-ray, and her bowel is like packed with poop. I've never seen anything like it. The diarrhea was like the overflow from the blockage in her bowel. After kindly giving the lady education about normal pooping cycles, I had the lovely job of inserting 3 enemas and regularly checking on her until the lava of Great Mount Fuji erupted from her anus. Huh, some girls really don't poop. I'm obviously joking. You guys should make sure you have regular movements. Story 45. My own story. Thanksgiving Day, wife's whole family coming to our house for dinner. I went to the restroom and find myself peeing blood, dark red. I assumed I had a bladder infection, and since I wasn't in any pain, I didn't want to ruin Thanksgiving, so I didn't say anything. After dinner was over and everyone had gone home, I told my wife. She immediately took me to the ER. They ran tests, put in a catheter. When tests came back, they told me I had a bladder infection. Duh. And stage 4 kidney cancer. Huh? Doc told me I had 1 to 2 years left to live. That was 3 years ago. And now I have no detectable signs of cancer due to an awesome drug/treatment trial. Is there an update to this? I want to hear more about this awesome drug. And congratulations to this guy. That's great. Story 46. Late, but this is a goodie. Am a PA. When I was a student doing clinicals in the ER, I had a middle-aged guy come in with abdominal pain, so I'm doing the exam, palpating his abdomen, and he's just saying he's a little sore. Looks really uncomfortable though, and like he wants to say something. I start asking him more history questions and asks if he had relations with a new partner. Turns out he was in the ER because him and his girlfriend get into some kinky crap, and she inserted a little flag into his chicken urethra during foreplay. Like the ones with little paper flags attached to a metal rod. Well, somehow the flag came off the rod and the rod was stuck in his urethra, but too far down for him to get it out. So he had to go into surgery. Oh, and his girlfriend didn't come to the hospital with him because she was too embarrassed. Story 47. I have one, but I am no doctor. I think it is quite unusual issue though, so I'm going to write it down here. My uncle fall down off a bike and headbutted the white plastic reflection thing. Later, when he was home, he realized that his left speakers are not working. So he fiddled with it, turns around, and suddenly his right speaker did not work. So he thinks it over and realized he is deaf on his left ear. 2 doctors have not a clue what is wrong, and he was sent to some obscure specialist, which told him he has just dislocated his ear bone. He put a stick with a ball on the end to his ear, punched the ball with a tiny hammer which corrected the bone's position, and he heard again. Story 48. Physical therapist here, treating a patient with a traumatic brain injury post-car accident. Was just getting him moving when I noticed he kept picking at his beard and then putting his fingers in his mouth. Couldn't see anything he was physically eating, figured it was some sort of tick after the TBI. Wrote it in my note and sent it to his physician. Looked in the note the next day before his visit and saw that they had discovered he had brain matter and cerebrospinal fluid leaking out of his nose and he was eating it. It was just so clear I couldn't see. Story 49. Not me. My dad, when he was early on in his training as a doctor, got an emergency call from the paramedics at night when he was one of the only doctors on call. saying the patient incoming literally had broken his chicken. A broken chicken. It turns out while the patient and his wife were doing the hanky panky, his chicken came out by accident, and she, while trying to put it back in, sat on it and crushed it. Story 50. Not a doctor, but I'm a garbage man, so it's kind of the same thing. I was picking up garbage inside the local hospital when I saw a doctor with his hand up a man's anus. I pretended to be busy while watching and saw him pull out a giant dildo. The man said, "Ah, that's where my eggplant went. Thanks, doc," and walked out of there. I'm not a doctor, I'm a garbage man, but I need karma. Story 51. They didn't hide it, but I guess just forgot about it. Patient was an obese female admitted for sepsis from cellulitis or a skin infection. She wasn't getting better, so someone thought to check in her folds. They found a bunch of little dark spots, which turned out to be splinters. There was a person in the community selling something called a love board, basically a 2x4 to lift up panis in obese patients to aid in intercourse. Sent the lowest person on the totem pole to get them out. Edit. To add another story about hiding I forgot. Was asked to see a patient about a breast abscess. As soon as you see it, it's obviously an advanced breast cancer. After talking to her, turns out she has known about the cancer but decided to see a naturopathic doctor instead of standard care. They ended up putting a garlic clove wrapped in a banana leaf in a small hole in her calf. Story 52. My sister was in medical school at the time that her group of med students saw this. A very well-dressed young businessman came in on an ambulance after suffering cardiac arrest. Weird. This guy seems healthy enough. Cut off his clothes. He's got what amounts to a raisin for a chicken. Turns out he had a drug habit, and his chicken was the injection site du jour for lots of jours, in order to maintain appearances and avoid noticeable track lines elsewhere on his body. His drug of choice is a vasoconstrictor, and over time this guy managed to mummify his ding-a-ling-a-ding-dong. He was unconscious at the time my sister saw him, so he didn't have much of a chance to lie in his defense. Story 53. Metastatic testicular cancer. A 28-year-old male would not believe he had cancer, and when there were 50-plus metastases/lymph nodes around his body, he would just wear baggy clothing, scarves, hoodies to hide it. It was monstrous. If only he knew that current treatments are pretty good for testicular cancer, and he's probably not dead yet after multiple surgeries. Another is penile squamous cell carcinoma. Less lucky that one, but it was a crater on his chicken that lasted at least a year. It almost smelled like death that he perfumed. Men tend to ignore urological cancers because it's an attack on their manhood. Story 54. I had a guy come into the ER for a stroke. He was 30 years old. Quite unusual to be that age and have a stroke. It was about 1 a.m. When I got to the ER, turned out to be a famous rock star. I was quite freaked out. However, after examining him, I decided it was not a real stroke. Plus, he smelled of a lot of alcohol. I refused to give him the clot-busting medication, TPA, based on the exam. Looked like he was faking it. He was admitted overnight for observation, at which time he sobered up. The next morning, the police showed up and arrested him for impersonating a famous person. This guy absolutely looked like the famous musician. It turns out he had been going around from town to town getting free limo rides, drinks, and intercourse for at least a year. He really came into the ER faking a stroke to avoid the police. Story 55. ED Doc. PTS routinely lie to me on a daily basis. I used to take it personally, but I have come to terms with it. About a third of what I see in a given day is related to complex psychosocial issues and not a real medical problem. Young girls who fake seizures for attention and their overly protective parents feed into it. Homeless people who swear they're going to jump off a building so they can get a meal and a bed. The intractable headaches or abdominal pain with a huge negative workup who really just need narcotics or attention, or both. I've seen people flat out lie through their teeth all because they can't deal with the stress of life. Just last night, a young male who got out of drug rehab 5 days ago comes in with abdominal pain. This can be a rather expensive and time-consuming workup with labs and CT scans, etc. I flat out ask him if he is using again, and he denies. He is obviously high but screams when I examine his belly. As such, I get some labs and a urine drug screen, positive for meth, heroin, coke, and THC. Labs, NML. I talked to him again. Sorry, doc, I was embarrassed about using again. He had come to the ER because he started shooting again and was ashamed. I talked to him a long time about addiction, etc., but he didn't want any help. I have hundreds of stories like this. The problem is that I have to take their complaints seriously. Alcoholics and crazy people still have real medical problems, more than normal people, and they sue when we miss them. The lack of trust between physicians and patients makes my gig hard. I'm always worried I'll miss something because the PT is full of crap, and I'm afraid that if I miss something, I'll get sued for 20 million bucks. Makes me order a lot of tests that probably aren't needed. Yet another reason medicine in America is so expensive. Story 56. I used to work in radiology, and we had this x-ray intern that was one of the most soft-spoken, sweetest people you'd ever meet, which makes this story even better. She was working the ER room, and we got a patient with a reason for exam of lower abdominal pain. When meeting the patient, she did ask the normal, "What brings you in today?" question. He, the patient, grabbed her hand and placed it on his lower abdomen, then asked if she could still feel it vibrating. X-rays confirmed, sure enough, he had lost his vibrator straight up his butt. His wife was there too, and she said this wasn't the first time either. And apparently, every time they do it, they drive an hour out of town because he's a radiologist and didn't want any of his partners seeing his x-rays. Story 57. Not so much bizarre as poetic justice. Had a woman in police custody brought in. She was caught red-handed during a break and enter and tried to run from cops. Police caught her and tackled her to the ground. She complained of pain in her shoulder because the cops were too rough. It was very clearly all bullcrap to delay going to the lockup. So I order an x-ray and shoulder is fine, but you can clearly see the metal box in her bra strap, which contained her quite sizable methamphetamine stash. Story 58. The power of denial is amazing. 2 stories. When I was a resident doing a radiation oncology cancer rotation, I interviewed a middle-aged businesswoman who was very nicely dressed. She was not sure why she was referred to our service by her family doctor, and we did not have a consultation letter. When we got her into a gown for the physical examination, we discovered that her right breast and part of her chest wall were completely eaten away from an aggressive cancer that had been untreated. She was completely oblivious and unconcerned by this. About a month later, I was doing a rotation through cardiac and thoracic surgery service. I was meeting my professor for coffee before we got started for the day. He was late, and when I saw him, I was shocked to see he was bluish looking and out of breath and could barely walk. The night before, when he finished work, he had developed a crushing pain in his chest, like an elephant sitting on it, and he went to bed. It took him an hour to walk from his condo across the street from the hospital to the cafeteria to meet me, a 5-minute walk. I took him upstairs to the cath lab and they dropped a few stents into him. And this guy's specialty was cardiac bypass operations. My advisor told me that the most important lesson was that denial ain't just a river in Egypt. Story 59. My mom, physician, was prepping a lady for weight loss surgery back when she was a resident. She's taking all of her vitals, doing all of the necessary pre-op questioning, and then starts to hook up her heart monitor. Bunch of sticky pads on the chest. This lady had massive boobs that are physically in the way of where my mom needs to stick everything, and she's actively trying to prevent my mom from accessing those places around her chest. Finally, my mom just says, "Look, this has to happen or no surgery." My mom lifts, literally, the lady's boob up and out of the way to expose the spot. And what does she find? A whole pack of soggy Oreos with a couple already missing. What the F? They had to postpone the weight loss surgery because she had recently eaten them and no longer had the required or ideal empty stomach before surgery. This lady literally had a cache of junk food stored under her breasts. Man, that's the dream. If I could sneak stuff into a movie theater that easily. Phew. Story 60. Had a guy come walking into the triage in the ER late one night. He had hunched over, not walking correctly. To give a better visual, he was walking like his stomach hurt and maybe going to throw up. Very slow, very calculated movements as to not disturb the juices. He is slight, average height, very skinny. I'm at the triage desk, and I ask him his chief complaint. Says he is constipated. I probe further, verbally of course. After about 2 minutes, I just come out and say it. What's really going on? His response, which I put as his chief complaint, "I have a giant dildo stuck up my butt." I lost the photo of the x-ray, but it was magical. Huge. We got it out with forceps, saved him a trip to the OR, but we kept the nightstick and proceeded to hit each other with it for the rest of the night. It was in a hazard waste bag X3 for sanitary reasons. Story 61. My girlfriend is a doctor, and she was on her ER shift when the guy came in with a serious pain in his private parts, but wouldn't say what it was. She wasn't really prepared for what was coming. The guy had advanced stage chicken cancer, and it was leaking from everywhere but the actual chicken, or what was left of it. She described it as one big crust between his legs, which was dripping and rotting, leaving the poor guy in serious pain. She said she had never seen and smelled anything like this before. Story 62. Not a doctor, but I had a professor in college who was, and she once told us she had a patient come into the ER with two police officers. He'd been found near a crime scene of a house break-in and claimed he'd been shot. He had this round hole in his leg, but no exit wound. My professor kept searching for a bullet and couldn't find it, and the x-ray didn't show any bullets either. The guy wouldn't admit it wasn't a bullet wound, so there was nothing they could do except sending him home. He came back the next day, limping hard, and he admitted that he had been the one who had broken into the house and had gotten that wound when trying to jump over the metal fence. He ended up in jail. I don't get it. So they couldn't help him unless he confessed? Is that what it's saying? Story 63. I guess not really bizarre, but more funny. Had a guy come into my pharmacy to drop a script for a pain med off. The doctor hadn't put a strength on it, so I couldn't fill it. The whole time he's on a motor scooter and complaining about just having knee surgery. He had long basketball shorts on, so I couldn't see anything. When I called the doctor's office to let them know they effed up and to call him something else in until he can get his script fixed, the lady who answers goes, "Oh yeah, the guy who just got the vasectomy." I was staring at the guy when she said it while he complained about just having knee surgery. I was like, all right then. Story 64. Most recently, my dad had a patient that had a cyst on his groin that had grown so big it looked like he had 3 testicles. He was putting off his prostate exam for months so my dad wouldn't see it. Girls trying to say they are virgins coming in for abdominal pain, and my dad has to tell them they're about to have a baby. One guy with diabetes who lost a foot and was going blind tried to hide a family dinner size bag from Bojangles in his coat and was stealth eating bites of fries and Bowberry biscuits, insisting he didn't know why his blood sugar was so messed up. Story 65. I've got 2. Guy comes in with high fever, sweating, etc., sepsis stuff. We start undressing him to get him into a hospital gown, and when we take his shoes off, we're hit with a horrible smell and the sight of a previously white green sock. The doc comes off and his toe is eaten away by gangrene. The following conversation takes place. Doctor, have you seen anyone about this toe? Guy, no, doctor. Well, it almost killed you. Guy, well, crap. Story 2. Our hospital was near a jail, so we would get inmates all the time. So this one night, the officers bring in an inmate who says, I was doing push-ups and my testicle disappeared. Yeah, so they do the tests, x-rays and such, and he indeed is missing a testicle. Everyone is stumped. Doctor finally digs up some patient history on the guy, and it turns out he had it removed long ago and was just using this as an excuse to get pain meds. Story 66. This one patient came into the ER and was put on the fast track side because his chief complaint was wound recheck and said he needed his packed abscess checked on. When we start talking to him, he said he was in a fight with his girlfriend and she made him an alcoholic drink with a little wooden umbrella, and he accidentally swallowed the wooden umbrella. So then he gets his chest and abdominal films done, and what is really seen is the guy swallowed a ton of wiring, kept denying it, saying it was a drink umbrella. We weren't entirely sure of the story until after he had to get the foreign bodies surgically removed. He had swallowed 2 Ziploc bags of wiring, one for a small toy and one for a TV. Then the GI that removed it said he hadn't seen something so weird since he saw a man who ate an entire raincoat. Dude, there's so much weird eating going on. An entire raincoat? Story 67. I'm not a doctor, but I had a buddy who texted me at 6 a.m. saying he was constipated and it was hurting him trying to go. Traffic was backed up on the highway, so I took the back roads there, but they were poorly maintained and bumpy. And after 15 minutes, he asked me to get back on the highway because the bumps were causing some discomfort. We get to the ED, and he has a very hushed conversation with the nurse. As soon as he sits down in a chair in the waiting room, two nurses come out to help him into an exam room. I go over and ask the intake nurse if he's going to be long, and she says, "Oh yes, he's going to be admitted," with a funny smirk on her face. The next morning, I wake up again at 6 a.m. to angry pounding on my door. I open it to find my buddy's older sister, who had never been to my house before, and the only way she could have found it was driving around my neighborhood looking for my car and pounding on doors, but there was at least 4 other identical cars to mine in my neighborhood, but I digress. She was looking for her brother because he never came home the night before, and I was the last person he was seen with. So I tell her I took him to the hospital the morning before and he was being admitted. So we all caravan down to the hospital, we all being his brother and 3 sisters, dad, and I, to find out what's going on with him and why he hasn't told anyone where he was. We get to his room just after the doctor gave him his post-op consultation. Turns out he had an 8-inch rubber dildo lodged in his butt, and me taking him on the bumpy road caused it to go even farther up, so they had to make an incision in his belly and manually massage it from his colon back out. Story 68. Okay, I may be posting this too late, but I think the story is worth it. So my roommate's girlfriend is a nurse, which means I'm pretty much a doctor. And she has this story about a guy that would come into the hospital semi-regularly with bladder infections. After a while, they began to pressure him to share what it is he had been doing to cause these issues. Well, one day they finally find out that he had been moonlighting as a human decanter at orgies. So basically, this guy pees out all his urine, inserts a catheter, fills up his bladder with wine, and goes around to the orgy peeing wine into people's mouths. Moral of the story, if you pee wine at orgies, make sure you get paid enough to cover medical expenses. Story 69. A few years ago, I had really terrible abdominal pain. I was shaking. I had the chills. I was running a 100-degree fever. So I went to my mother, a former pediatrician who retrained and is now practicing allergy/immunology. She was obviously very concerned, so she called an obturator test to see if I was having an appendicitis. Sure enough, I writhed in pain, so she rushed me to the hospital. Before they opened me up, they wanted to make sure that it was indeed an appendicitis. So they took me in and put colored dye in my blood or whatever and gave me an MRI/CAT scan, can't remember which. Turns out I was massively constipated. In the words of the attending, "I've never seen so much fecal matter in someone in my life." They had me all narked up to help with the pain, so I was even more constipated after that. Spent a few painful days on the porcelain throne and crapped myself for a week straight. Good times. Too long didn't read. I was admitted to the hospital because I was in so much pain that they thought I was having an appendicitis. Cue endless family jokes about how I'm full of crap. Story 70. I'm an EMT in a rural area. A few of my favorites. Do you have any medical conditions? No. Do you take any medications? Insulin for the diabetes. So you have diabetes? Not anymore. That's what the insulin is for. Do you have any medical conditions? Yes. Would you like to tell us what they are? No. Do you take any medications? Patient lists a few HIV drugs. And my personal favorite. We're dispatched to a residence for complaints of chest pain. We do an EKG, ask about medical conditions, emphasizing any possible cardiac history, and we do what we can while transporting to the hospital. We get to the ER and are wheeling the stretcher into the patient's room when she says, "Oh, by the way, I got part of my lung removed." When we ask which lobe she had removed, she points to the area where she said her chest had been hurting. Fun fact, a lobectomy is considered medical history. Story 71. Pregnancy. I saw a woman come into the ER with abdominal pain and looked like she had a beach ball in her shirt. The nurse asked how far along she was, and she said she wasn't pregnant. So we did a pregnancy test that came back positive. She didn't believe it and told us there was absolutely no way she could be pregnant. She gave birth within 1 hour of being admitted. No joke. But I guess that's denial. She wasn't trying to hide anything. Story 72. Obligatory, not directly from a doctor. My mom has worked in several hospitals, but one story sticks out in my mind. She works with processing charts, and I want to make it clear she doesn't disclose dates or names or even which hospital this was at. A man came into the ER crying, absolutely sobbing and covered in blood. Of course, doctors and nurses were on top of it, asking what happened. He said his testicles hurt. Okay, explains the blood covering his pants. I'm not sure what happened in between the ER and the exam room, but his testicles are gone. They ask what happened. Where are your balls, dude? He says they're in his car. Also lost for details here, but apparently he kept saying he didn't know where his balls were. They were just gone, magically disappeared. I don't have balls, but I'd like to think they don't take random evening walks on their own. Finally, he relents. They went to his car. They were in a jar in the trunk. An empty, but not cleaned out, mayonnaise jar. I have so many questions. I think out of all the stories so far, this one I'm the most perplexed by, and I need to know more. Story 73. Woman, 57-year-old. Small, 5mm nodule, lower eyelid. Most probably basal cell carcinoma. Harmless. Needs to be excised in a short office procedure, 15 minutes. Local anesthesia. Woman refused, but strangely enough came in every 3 months to refuse the operation. The thing slowly grew. I saw her 5 years. For the final 3 years she did the blossoming tumor with a folded up sheet of Kleenex behind her glasses. In the end, she agreed to an operation. It took 7 hours. Eye, muscles, bones were removed. Afterwards, she could have eaten and breathed through the gigantic hole where the eye used to be. Too late. It spread. Radiation therapy. Death was at least quick by an erosive bleeding of the carotid artery. Story 74. ER doc here. On the charts, it usually states your chief complaint of what is troubling you and which brought you to seek medical help. Usually, it's 2 to 3 words like SOB, short of breath. Once I had a 20-year-old guy with penile discharge. I looked it up, it's just a yeast infection. Written as his chief complaint, which is really odd. I walked in the room. Hi, I'm Dr. F. I understand you have penile discharge? Yeah, it's a yeast infection, he says very confidently. It's not a yeast infection, I countered. He hung his head to his chest and shook it. Yeah, it's not a yeast infection. You've got an STD, like chlamydia. Still shaking his head. It's chlamydia, I know. Wasn't sure at first why he'd try to pretend it was nothing when that prevents proper care. Until I went to the next room and met his girlfriend who had the same discharge, and sadly also knew herpes lesions. Felt really bad for her. Not only did she have an unpleasant infection, but she was clearly dating an idiot. Another case. As a resident, I took care of this madly addicted meth homeless man in the southern USA. I say madly because he actually got shot once and the bullet went through the muscle on the lateral pelvis, not through the abdomen. Well, he continued to smoke and smoke for weeks on end despite the wound getting infected. At one point, it progressed to be an infection of his pelvic bone, osteomyelitis, and it became septic. When you get a bone infection, we can try to treat it with antibiotics, but they don't penetrate the bone well, and sometimes it's just too late, so the bone has to be removed. He ended up getting a hemicorporectomy. Everything below the belly button was amputated. First and only time I've ever seen this, thankfully. Story 75. A friend of my girlfriend told her that she bleeds down there about 3 weeks a month, every month for the last couple years. She said that it was healthy because it's another way for the lady parts to clean itself. Anyways, after my girlfriend told me that, I had forgotten about her for a few weeks until I finally remembered and asked her how she was doing. My girlfriend said that she finally went to the doctors and they told her she had stage 4 ovarian cancer. Roughly 2 weeks later, she passed away. Her whole family was obviously devastated, but the thing is, nobody knew. She hid it very well. Either that or she honestly believed it was normal to bleed like that. Ah, man. Look, I'm obviously not one to come to for health advice or anything, but if there's anything I'm learning through here, is that if you guys feel like anything is off or unnatural, please go get it checked out. That's really sad. Story 76. Used to have this patient that would come into the ER with a rather low HB time and time again with no signs of external/internal bleeding. Turns out they were venipuncturing and withdrawing craploads of blood at a time. Also another patient that would stick razor blades up her lady parts or shards of glass and wouldn't let anyone remove them and would just sit in her room curled up whilst it stank the room rotten. And another lady who was elderly who for years had been sending her husband out to buy her cotton wool pads. Turns out she had been padding this gigantic hole in her breast from breast cancer, and she never wanted to go to the doctor due to a bad childhood experience. Sadly, she died a few days later, and her family were distraught that she had kept this a secret for so long. Story 77. Not a doctor, but the patient, and I'm pretty sure the doctor never found out anyway. This was barely 3 years ago when I was 20. I had a very bad case of diarrhea, nausea, vomit, and stomach pain. When I couldn't handle the pain anymore, I asked my mom to take me to the hospital. By the time I got admitted, I was severely dehydrated. They put me on IV and poured 2 bags in me in 20 minutes. I just had a really bad infection. Don't know the name, but they gave me some strong IV antibiotics. The doctor kept asking me what I've eaten the past few days, and the truth is I couldn't recall anything that would have made me that sick. What I never told the doctor or my parents is that a day before I started feeling sick, I had relations with my girlfriend, and it was my first time trying butt. Story 78. A patient comes into ER with a case of food poisoning. We do the usual assessment. Patient just wants something to clean out my tummy. Suspicious. We convince her to have an x-ray. That's about 25 batteries all counted. She'd been eating them for the past 2 days. Some were dangerously close to being corroded through because she had constipation and thought that something heavy would just clean them out. Story 79. My mom did intake in an ER. A man came in with bloody open wounds on his hand. He said he had burned his hand on a radiator. After being stitched up, the dude disappeared. Turned out he found the staff cafeteria and stole my mom's car keys out of her coat pocket. He stole my mom's car and went back to the house and filled the car with a bunch of stolen goods. Turns out he murdered an old lady during a home invasion earlier that night. He cut his hand while stabbing her. Dude was caught that night, and my mom's car was impounded. Funny side note, when my mom picked up the car, the police told her to just keep the stuff in the trunk for her troubles. Like they told her to claim the goods on the police report as being already in the car. She said no, but they left one of those old school sleds, the wood and metal ones, in the trunk anyway. She never took it out of the trunk. It was there until the day the car died. I remember grocery shopping and stuff and always just filling the trunk with stuff on top of the sled. Story 80. A huge, bigger than the Trump wall build at the Mexican border, inguinal hernia. I was a med student doing a general surgery rotation. Usually someone has a groin pain and says something like, "I think I have a hernia." You look, see nothing, then feel, and don't really feel anything and do surgery anyway. This guy was a big guy, probably around 6'4" and 400 pounds. He dropped his pants and I expected to see nothing unusual, but instead his scrotum was around the size of a cantaloupe. I recoiled and said something like, "What the frick?" I went and got the surgeon and didn't prepare her. Just asked her to come look at it. She walked in, took a look, and you could see the jolt go through her. Then she said, "It looks like Mickey Mouse." This was because his testicles were perched way up on top like Mickey's ears. Then she apologized, but was a little shaken. We exited the room and she said in 20 years, including her residency, she had never seen a hernia like that. We did the repair and 18 inches of intestine was in his sac and 9 pounds of fat. I had to push the fat back up into his body. It wouldn't stay. I would get his intestines back in and most of the fat, and then the pressure would shoot it all back out like a scrotal jack-in-the-box. We finally had to tip the table upside down and let gravity assist me in getting his guts and fat back in his body. I am not a surgeon, but asked the attending surgeon if I could just throw the fat away. They said, no, it all had to go back in. I still wonder why I can't just throw the fat away. I don't think he would miss it. 2 weeks after surgery, he came back for a follow-up. The secretary came and knocked on the attending's door and said, "Mickey is in room 1. We lost our crap laughing. Huge like the Trump wall. It's huge. It's a lot of people. Story 81. I was having stomach pains for about 4 days. Finally, after work, went to the hospital because I thought something wasn't right. Too long didn't read, my appendix had ruptured and it was removed hours later. When I was being discharged, the team of doctors were doing rounds. The nurse removed my IV and told me to lay still and proceeded to take my blood pressure. I'm watching the first half of the England game on my bedside TV and think, have I just wet myself? I look down and see a puddle of red rapidly growing. I panic and start screaming for someone to help. Turns out the nurse had removed my IV and taken the BP on the same arm. So the resulting pressure made me a blood fountain for a few seconds. The most scared/amount I've cried with laughter in my life. Story 82. A patient came into the ED with severe pain in her buttocks on both sides, as well as fevers and some indications of infection. After further evaluation, she was diagnosed with a nasty deep tissue infection requiring inpatient hospitalization and IV antibiotics. But the question still remained as to where the infection came from. As it turned out, she had read online that rubbing fish oil on your butt can make it more voluptuous. She figured if it works on the surface, it might work even better on the inside. So she took her insulin syringes and withdrew the fish oil from an oral capsule and injected herself with fish oil daily for 2 weeks until she inevitably became infected. And no, her butt was not more voluptuous. It was red, swollen, hard, severely tender, and she was unable to lay on her back or sit down for weeks. Story 83. One day, my wife went with her father to a doctor's appointment. He had already been to 1 or 2 in a series on his own, and she found out that he had been telling the doctor that his family had absolutely no medical conditions or history, like everyone had died in combat or something, although a few of them had, and he also had one deaf brother who was hit by a train he did not hear coming. Roughly half of his family have died of cancer or heart conditions. He is no longer allowed to go to medical appointments on his own. The train was still on the tracks though, wasn't it? Story 84. The patient was caught injecting used toilet water into his IV. He was an IV drug user and was trying to get bacteria in his blood so that he could get an IJ, a central line that goes into the jugular vein, so that when he left against medical advice, he would have an easy IV access for drugs. He had a long history of all kinds of nasty bugs in his blood. He would stay long enough to have some antibiotics and then bolt with his fancy new IJ. Story 85. Had a large lady come in who needed to get a scan before entering a strictly controlled diet. What shows up? 2 McDoubles under one tit and a half liter of cola under the other. She then starts to complain the hospital isn't feeding her enough and they are starving her. Story 86. In 1983, I was a medical resident in New England. We had a patient admitted for better control of end-stage renal disease related to diabetes. The patient had already undergone above-the-knee amputation of a leg 6 months prior at another hospital due to vascular disease. This is important to the story. The patient was married and they had a 19-year-old child. The patient's wife related that 1 month prior it had been discovered that her husband, who had been a construction worker and truck driver, was actually a woman, masquerading as a man for decades. I participated in the interview of the wife by a psychiatrist, and she swore she had no idea that her husband was actually a woman. She was already pregnant when they met, and when asked about relations, she said, "I don't know, but he managed." She continued to refer to her husband as he throughout the prolonged hospitalization. But here's the amazing part. The patient underwent an above-the-knee amputation, for which they have to prep you and disinfect your skin. How did nobody notice that something was missing on this man? Story 87. A friend of mine is a surgeon who works in proctology in a hospital in Switzerland, and that story is pretty unusual. Patient is a very athletic guy, in his late 30s, solar bench tanned, very well groomed, and all in all, he looks very anxious. He complains about intense itching sensations in his anus/rectum. GP couldn't find the cause. My friend first had a conversation with him asking about any recent unusual activity in that area, but he denied and said 20 times that he's not gay. My friend insisted, saying that he's not there to judge and that it has nothing to do with being gay, but the patient confirmed his answer. After deep checkups with appropriate tools, my friends found very intense, abnormal, effed up irritation which could have only been caused by an external product. But he couldn't guess which product at that stage and needed to find out to be able to cure it ASAP. So we asked again, and the patient denied it again. "I already told you, I'm not gay!" So my friend tried to scare him and went like, "Sir, considering that you are 100% sure that any kind of substance, product, or objects have recently been inserted into your rectum, what I found there is really not normal at all and looks like a severe mutation of some kind. We need to cut it off to stop the progression, which would imply an artificial anus. That scared him and his pants right off, and he started talking. Okay, I'll tell you, but you have to promise me that you'll never mention my name when you'll laugh about my effed up story with your colleagues. Sir, I'm not here to judge or laugh. I'm here to cure. Okay, so, I'm not very gay, but, sometimes when the excitements arise, crap can happen. So here's the story. He was having a foursome in his garden with his wife and another couple. They swapped wives. It was fun and all, and then when the excitement arose, as he put it, the woman went together and the men ended up together as well. So that guy was in the passive position, obviously, and his partner of the moment was missing lubricant. And they were in the garden, and there was no lubricant, and that was annoying, and there were a few slugs in the flower beds, and there was no lubricant, and they were very excited, and F it. Why the F not, right? And they tried using the slugs as lubricant, which obviously didn't work out at all, but it was already too late. So the slugs were stuck in there for a too long moment, and you guessed it, they emit an irritating substance as a self-defense mechanism. Of course, the guy was so embarrassed that he did not go to his doctor immediately. My friend never heard what happened to the chicken of the active sex partner. Of all the things to do when the excitement arises, as he said, that's not one of them. I will tolerate no slug abuse. Story 88. ER nurse here. People lie about the origins of large abscesses in the bends of their elbows. I don't know, is a common answer. Come to find out, it's from dirty needles, and the infection is so far advanced the risk of losing the arm becomes pretty realistic. 9 times out of 10, based on experience, an abscess is that place is from shooting up. Anyone reading this who shoots up, please get these infections treated ASAP and use clean needles or inhale. I know it's embarrassing, but you can absolutely die, and some things are worse than death, like losing an arm or permanent organ damage from raging infection. We won't call the cops. We just want to keep you alive. Edit. If you don't believe me, Jared Leto's fate at the end of Requiem for a Dream is totally real and in my eyes a fate worse than death. Story 89. I had a 50-year-old guy come in for anxiety. He's pretty well-to-do, very well-kept. Talks for a bit and ends up he is hallucinating, hearing things through the walls of his apartment. Not entirely convinced the voices aren't his neighbors effing with him, but it's bugging his partner enough so he comes to see me. No drugs, rarely drinks, never experienced anything like this. Send him for a head MRI assuming some sort of tumor. A week later, get some blood work done as well. Positive for meth. He acknowledged doing some crystal every now and then, but always right before the voices start. Problem solved for the $4,000 it took for a head MRI, and it cut right into his meth budget. Story 90. No relation to hiding it, but still one of the best stories we have around in the hospital to this day. This was a couple of years back, and until today is still something I wish I'd never have to deal with. We were packed, and what generally isn't my role was mine. New Year's Eve. All was great and normal as it was every other day until this dude came in, wheeled out of an ambulance with what was probably a king-size comforter on his lap. His girlfriend, God, I hope they broke up, was freaking out and kept repeating chicken rose, chicken rose, chicken rose. Fast forward, calling security on the girl and getting the boy comfy, it turned out she was right. It was chicken plus rose. He shoved it all the way in, and the first thing he said after I had a look was, "Nice, huh?" I asked why, and he said her ex once wrapped his chicken with a ribbon as a New Year's gift, and he wanted to one-up the other dude. What's worse was that he had to trim it down quite a bit to get it to fit, but he trimmed in a single direction which allowed it to go in easily, but getting it out on the other hand. Story's much longer, but a summary would be a better thing, I think. Story 91. Heard from a physician who deployed with a grunt marine. Jarhead grunt comes in like 2 weeks after a port visit because he can't pee. Doc assumes it's some minor VD, but is surprised it took so long for said bullet sponge to report it. Worth noting, this was apparently an enormous marine. Not terribly sharp, but tough as nails, as you will soon understand. Anyhow, Doc says, "Let me see," and expects the drip. and is shocked to find a short piece of metal poking out of this Marine's chicken. Doc asks, are you aware that there is something metal in your chicken? Jarhead answers, yeah, Doc, that's a coat hanger. Doc, now completely shaken, asks, how did it get there? Jarhead answers, well, I couldn't pee, so I thought it was blocked. So I unbent a coat hanger and tried to unblock it. The coat hanger got stuck, so I just cut off the rest. Doc, now completely floored, when was this? Jarhead, 5 days ago. Surgery followed and the kid was fine, but he had 6 inches of coat hanger up his pee hole. Story 92. Up to yesterday, I had a patient with hypertension and diabetes. Blood pressure through the roof. 4+ sugar in the urine, which means his diabetes is uncontrolled too. I ask if he's on meds for it. Yes, doctor. You take the meds every day? Yes, doctor. But he can't remember the names. How many meds are you on for the diabetes? About 3. 3? And the sugar isn't controlled on that? Who do you normally see for your hypertension and diabetes? He gives me the doctor's name, but to tell you the truth, I haven't seen him in years. So essentially you haven't been on your medications for years then. Well, I have to tell you the truth. No, doc. Really, bro? Story 93. Not a doctor, but when I was about 10, I lived in the backwoods of Louisiana. It wasn't uncommon for kids to do heavy chores. My neighbor, about the same age as me, was chopping wood with a double-bladed axe. When the axe head came off mid-upward swing and lodged right between his eyes, smack in the forehead, he turned around and looked at me all puzzled, and I immediately freaked. Neither of our parents were around, but there was a fire station about 2 blocks away. I walked him there, and we just sort of waltzed in, me holding this boy's hands while he stares around with a confused look and an axe head sticking out of his forehead. The firemen just about crapped themselves and ran him to the ER in a fire truck. Since our parents weren't around, I got to ride with him and hung in the ER with a fireman until both our parents arrived. Turned out the axe wedged right between the 2 lobes of his brain, and he was a hair away from brain damage. Story 94. I had an elderly man with early dementia try to cover for not knowing where he was. Me. Okay, sir, do you know where we are right now? Him. Sure. Me. Okay, tell me where. Should have been more clear. Him. Right where I'm supposed to be. Me. And where is that? Him. This place. Me. Okay, what is this place, other than where we are? Him. A building. Me. Seriously, sir, where are you? Him. In a room. This went on like a vaudeville routine until I finally asked, what type of building is this? And don't say a big one. He finally said he had to think about it and get back to me. His family had no clue. They would come in and just say, oh, Dad, you're such a kidder. So if the family had no clue, did he have no clue? Like, did he know when he was covering it up, or was he genuinely forgetting and not knowing? Oh, that's sad. Story 95. A young guy came in with penile pain. He had shoved the plastic strap from a camera up his chicken. When the urologist, a 6-foot-plus, strapping guy came in, he got sweaty and squirmy and answered everything in a breathless, yes, doctor, way, kind of like a male Marilyn Monroe, and developed an erection. The urologist took me aside and said he was going to be a little rough because he wanted to teach the guy a lesson. He set up the scope, and the entire time, from the time the urologist stepped in the room until he yanked that strap out roughly, the patient was very obviously having a very good time. Huge dilated pupils, sweating, panting, every physically sign of sexual arousal ever. To this day, I don't understand how the urologist didn't see it. The patient released just as the strap came out and the stuff hit the urologist, who was wearing a gown, but still. So what was the guy trying to hide? That he really enjoyed having angry urologist roughly pulling things out of his chicken. A lot. Story 96. I have a family member who is a surgical tech. She often has the best stories, but this one has stuck with me for years. A female PT came in complaining about severe abdominal pain. The nurses peeped the woman to have a lady part check. When the doctor came in and lifted the sheet where there are bugs crawling over the bed, and we're not talking just a few. Long story short, this woman ended up having a large steak shoved up into her lady parts that had been there for quite some time. She was full of bugs. My family member never did find out why this chick shoved it up there, and I can't look at steak without gagging. Story 97. Had a guy complaining his stomach hurt. The wife was so kind and supportive, but in a weird euphoric kind of way. X-ray showed a huge glass vase jammed up his rectum and above. Wife says he accidentally sat on it, and she shouldn't leave those things laying around the house so carelessly. Stupid me, stupid, stupid. So emergency surgery before the glass breaks. I don't think anyone can sit down and have that happen, and I never found out the real story. X-ray was an impressive sight though. Story 98. I think probably your best stories will be unidentified rectal objects or psychotic patients. Anyone who has watched Scrubs knows the butt box, and any doctor out of training probably has at least one butt box story. This is my first and still best. I was in medical school doing my radiology rotation with an interventional group. They did some super coot stuff with fluoro and wire. One day we were doing a procedure. I've since forgotten which one exactly. I'm guessing something like perc nef, something with sedation, so the patient had to wait to recover for a bit. Anyways, we do the procedure and things go smoothly. I went back to the reading room with the doc to get caught up on some films. We sat down at the box. This was back when everything was filmed, so we had the big auto rotator that would spin the next film at you, and he started dictating the perc nef guy. All was well, and at the end of every procedure, like that they shoot a film of the whole abdomen to make sure nothing really bad had happened, right then the specials tech that did the case with us came back, and I'm sure it was like something out of a movie. The whole belly film showed up, and we all cocked our heads to the side completely confused. There were 3 radiopaque, bright white, objects down in the pelvis, one shaped like a circle, one more of an oval, and one T-shaped object, all the same size, close together. The tech said, "What are those?" The radiologist was befuddled. Me, with the mind of a child being new to medicine, said, "I think those are pushpins." We went round and round at first. "No way, can't be." Then arguing, "Where in the office do we even have pushpins to have them fall on his back before we gowned him?" Then finally I said they could be inside him. We didn't have a lateral wide shot, unfortunately, so no way to know for sure. The radiologist then tried to figure out why anyone would be stupid enough to swallow pushpins. And dear Lord, how long had they been in there? After a couple minutes of this with the tech, again I said, "You know, there's a much shorter distance to get where they are." There was a quiet pause. Someone is going to have to tell him what we see. He can't leave until we figure out what that is. Me and the radiologist looked at each other, then at the tech. He sighed and defeatedly walked out to the recovery room. A couple minutes later, he came back, I kid you not, white as a ghost. What did he say? Well, I told him the procedure went well. No complications, stents in place, etc. Then I mentioned we took the last shot to make sure we weren't missing anything. When we went to look at it in the room, we noticed some metallic-like objects that seemed to be in the pelvis. They aren't anything we typically use in the procedure, and we aren't sure if they are on top of or inside your pelvis. They looked like pushpins, but we just wanted to see if you knew anything. Then the patient cut him off. "Yes, I know about those. Please don't tell my wife." The tech didn't say another word. We were too afraid to ask anything further. The radiologist dictated as best he could. Kinda wish we would have asked more. Still have no idea and never heard anything more about it. But that plain film is burned into my memory. I can still draw it to this day. Story 99. Not a doctor, but my sister is a nurse. She was working in the ER when this lady came in with a nasty rash on her legs. She was being cagey about what had happened, and the department was particularly busy that evening. So my sister told the woman either to tell her what was going on or she would have to go help someone else. Apparently the patient had been sleeping. She awoke when she felt a strange bumping sensation on her leg and looked down to see her pet chinchilla humping her. As the patient described it, this continued without interruption for a short while before the chinchilla went. "Went?" my sister asked. The patient then made a splooshing motion with her hands. It went." My sister nodded her head and said she'd go get the doctor. She barely made it to the hallway and shut the door before breaking down laughing. Eventually, the doctor came by to see what was up. My sister filled him in, and they had a good laugh. The doctor then pointed out that in order for the patient to have a reaction, this had to be at least her second chinchilla spunk money shot. After that, the doctor wrote a script for some topical cream and advised that the patient avoid chinchilla semen in the future. Story 100. Had a girl pretend to be unconscious so we wouldn't discharge her after a short outpatient surgery. It was weird because it's really hard not to react to things like sternal rubs, so we knew she was awake and with it. She just wouldn't talk, open her eyes, move, etc. Eventually, we did enough painful things that she opened her eyes, moved, then went back to sleep. We kept her in the hospital overnight, and in the morning she went back to acting normal, like nothing ever happened, and went home. She was a weird girl. Rumor has it she was a medical student also. Story 101. Not a doctor, but have a friend who is. In his medical training, he told me they would take care of prisoners at the local prison. One prisoner comes in for a visit. This prisoner has a crap bag that is connected to his body through a surgical hole in his stomach. Anyway, he is complaining of stomach pain. Doctor inspects the hole and notices some sort of infection in the area of the hole. After testing, it is determined the infection is in fact genital herpes. So the prisoner had been getting his stomach bowl banged by another prisoner with herpes. Disturbing to say the least. Story 102. I have a friend that's a nurse. One day I asked her what her worst insertion stories were. She had two. She asked me, in the butt or in the lady parts? So I said anal. Warning, wall of text, anal. There was a man that had come into the ER complaining of severe abdominal pain. He was admitted, and while he was chatting with the doc, the man was visibly uncomfortable. So the doc ordered an x-ray to be done. Once the results were out, the doctor was standing at the x-ray machine just staring at it. Until my friend walked by. Sarah, the doctor said, beckoning her forward. Come here. My friend was confused, but complied with his request. However, once she saw the x-ray, she understood completely. Doesn't that look like an apple to you? Asked the doctor, and my friend nodded while holding back her laughter and said, Yep, it certainly does. The doctor asked the man if he had anything to tell him. The man stuttered, and it took a while to drag the info out of him. But anyway, at the end of this story, the man had to get surgery to remove the apple from his rectum. Though, when a person has an object removed from their body, a complete breakdown of the item has to be done. So my friend got to look at this ridiculously long report of that dang apple was made out of, and at the end it said, looks like a golden delicious. Vaginal. A woman came into the ER complaining of a strange discharge coming from her. You guessed it, lady parts. So she was admitted, and a male nurse saw to her. As a note, the male nurse was gay and was relatively flamboyant. Anyway, the woman had her legs hiked up, and the male nurse has his head under the blanket looking at her hoo-ha, but suddenly he jumped back, looking terrified. My friend, in a bout of good-natured ribbing, joked that the male nurse couldn't be that afraid of women, but then he looked at her, fear and confusion clouding his eyes, and said, Something blinked at me. My friend is bewildered and ducks under the blanket to see for herself. And sure enough, she saw something blinking. Something small wedged up a woman's lady parts was blinking at her. I'm not sure what happened next, but it was a turtle. A tiny pet turtle. Tad the vag turtle, my friend called it. The woman somehow believed that her lady parts was a more suitable tank than which her turtle had been in, and managed to wedge him up there. And before you ask, my friend didn't know what happened to the turtle, and it still makes me sad to wonder if he went home with his owner. Oh my gosh, look, the objects are weird enough, but let's stop shoving live animals up there. Alright, this is not okay. Heroes in a hellhole, turtle power. Story 103. I once admitted a woman who was brought in unconscious. She faked being unconscious or unresponsive to prove a point to her husband. For any ordinary person, she was totally believable. But as a medic, we do the blinking test to confirm unconsciousness, and she failed. I diagnosed her with acute conversion D/O. So, to prove my point, I gave her a subcutaneous shot of sterile water. Super painful. And she screamed out loud. The entire scene was surreal, to say the least. Story 104. Not a doctor, but geez, do I have a story relating to this. When I was younger, I used to love climbing trees. And I was in France, and basically a branch broke, which led to me falling and breaking my leg really badly. When I was being rushed to the hospital with a bone sticking out of my leg, and mom and dad asked what happened, and I said, I tripped and fell and twisted my leg. The doctors told my mom and dad it was not physically possible to have done what I did through a trip. I only didn't want to tell the truth because I didn't want my parents to tell me I wasn't allowed to climb a tree anymore. Also, side fun story, the doctors in the French hospital couldn't believe a boy from Ireland had broken his leg in France, and I had about 30 doctors come in just to look at my file and then leave. Story 105. Not a doctor, but a patient. I often sometimes make appointments when I'm in an insanely panicky phase. I'd say manic, but I've never been diagnosed as bipolar. Here's why. Usually when I go to the appointment, I'm feeling better and out of that panic. So I go and just kind of fumble around the issue because I'm too ashamed to admit what's going on mentally. I've gotten better, but I'm still having a hard time sane. I have insane thoughts that throw me into day and week-long tailspins. I fear death constantly and think about it more than I don't. I am paranoid constantly in a state of panic 90% of the time, and I can barely function as a human being outside of work. I typically just mention, yeah, my anxiety's been pretty bad lately. It's freaking exhausting. I mean, look, I'm not going to diagnose you with nothing. I don't know what any of that could mean, but I will say I pray for the courage that you eventually ask for help. Hope you're doing okay. Story 106. Family practitioner here. Had a new patient into the office and was asking about past medical history. She denied any long-term health problems. We finally get to the med list. First thing on there is insulin. When questioned, she stated that that was for her high blood sugars, but she doesn't remember being told she has diabetes. Also working in the ER, another lady that apparently has diabetes and lives in her car had a large wound down towards her ankle. She claims that she cleans it regularly but has been driving for a few days and hasn't changed the bandage. She came in because it was starting to feel weird and is making a sound. She was so large she couldn't actually bend over to see the wound. Expecting some ginormous infection, I removed the bandage to find a good-sized clump of bugs having a field day. She ended up with an amputation as well. Story 107. Frequent flyer to the ED. Would come in periodically for various BS ailments, aka drug seeker. When he would be discharged with no pain meds, he figured out a way around that. He started a new thing where he would take too many of his ED drug, resulting in the greater than 4-hour erection with severe penile pain. He would then be admitted to the ED where we had to aspirate the blood from his chicken, of course treating his pain while doing so. He came in more than once. Story 108. Had a patient in the ICU who came in for shortness of breath. Little old lady, very sweet but also very hesitant to let anyone do a real exam on her in the ED. Wanted to change into her gown with the curtain drawn without anyone else near her. Okay, fine. Everyone is entitled to their privacy. CXR, whiteout lungs, filled with fluid. Thoracentesis in ED, still filled. Sent to ICU. Wouldn't even let the ICU nurses put telemetry electrodes on her without a fuss. Started to see some weird staining on the front of her gown. Nurse finally convinced her to let us check. Giant fungated mass on her breast. She says it's been there for 7 months. Invasive ductal carcinoma. CT showed it was all over her chest already. The lengths people will go to protect their psyches is astounding. Story 109. Not a doctor, but this is something I did. I was drinking a lot and hid that fact from my wife. She saw me acting slow, slurred speech, and the norm that comes with drinking, but I denied I was drinking. She played along and made me go to the doctors, trying to get me to admit it. They scheduled an EKG and an MRI to see what was going on. They end up finding a large brain tumor that has been growing for a while. I got lucky that they found it and taken care of and learned my lesson about drinking as well. Story 110. At a government hospital in a still developing country, the OPD Department of Medicine saw a thin and gaunt man. As one of the very juniors, I was standing back and observing and noting. This guy said he was perpetually having fever for which he has eaten NSAIDs every day for most of the year. He presented most of the signs and symptoms of AIDS. The examining doctor asked him if he indeed suffers from the ailment and whether he knows about it. The poor guy suddenly stopped talking and got up nervously searching for his file. The doctor tried to calm him and make him sit down. At this point, he got very defensive and totally bolted to the main entrance. Story 111. Not a doctor, a nurse. I once had a patient who had bloody diarrhea, nausea, and vomiting every day. Couldn't find the source, so we started to get sketched out. We soon found out that she was stealing syringes and drawing blood straight from her portacath catheter and chest that goes directly into a heart for lab draws / IV fluids and meds, and injecting it into the toilet to make us believe her. She had Munchausen syndrome. Story 112. I had a perianal abscess, which was loads of fun. All my nurses seemed pretty happy that I was pretty unashamed of anything and all had crazy stories. stories. One nurse had a patient who had had one for 2 years, constantly lancing them herself with a knitting needle as she was too ashamed to go to the doctors. Finally, one day she missed and stabbed a hot knitting needle straight into her bumhole, causing crazy bleeding, and she finally relented and went to the hospital. Story 113. Had a patient come in and say he had a friction burn. He would not say where it was initially, but when pressed, he finally just pointed at his crotch. I tell him at one point, just show it to me. When he could not produce any explanation for how a friction burn happens on the chicken, he shows it to me and he had a chancre from syphilis. He was incredulous. He then became really quiet and said, "Doc, I did something I shouldn't have." My only response was, "Dude, you have syphilis. You don't say." Story 114. Not a doctor, but my friend was a healthcare aide. The most bizarre issue he's seen as a patient tried to hide was the status of their poop. Patient was supposed to have poop checked for possible whatevers. Patient claimed to not be able to poop for a week. Patient is under observation. Patient is given things to help them poop. Still, no poop. My friend, the healthcare aide, comes in to check on the room. In the process of making sure everything is in order, he notices that the room smells a little more like poop than normal. No biggie. He's been warned. Checks the bedpan. No poop. Strange. "Did you have a poop?" he asks. "No, I can't poop," she answers. He thinks, maybe someone had something on their shoe. So he continues taking care of the room until he finds the source of the smell. Opening one of the cabinets, he finds, you guessed it, a few days worth of poop. The patient was crapping into her hand and hiding it in the cabinet. Now I know what you're going to ask, because I asked it myself. How come no one noticed it? Didn't it stink? My friend's response, yeah, it did. It was my first shift on that ward this week, though. I don't know how they couldn't notice it. Pause for effect. I guess no one gave a crap. Story 115. EMT here. This old guy fell in his kitchen and while going down the bottom of his jaw, hit the kitchen counter and a glass of water on it, breaking the glass and slicing his jaw wide open. So what does he do? He cleans himself up, changes his clothes, and strolls out on his apartment like nothing happened before, falling down again out in the hallway and staying down until we picked him up. Old people have loose skin and it wasn't bleeding, so you could see the muscles and whatnot in his neck. Story 116. I wasn't hiding an issue, but I had a severe tooth infection and a doctor that was too eager to prescribe pain pills. It turned out I'm also severely allergic to Vicodin, so I had taken these meds, was super sick from them, and was still in excruciating pain. Finally, after several days of not sleeping, the doctor called a 24-hour pharmacy for me to go get some other pain meds. I showed up at midnight, in my pajamas, completely disoriented. The pharmacist asked for my address, and I had to ask my boyfriend to find my ID to read it off to him because I couldn't remember it. Shocked me that he didn't question me more and filled the prescription. Story 117. I'm not a doctor, but I was a massage therapist, and we had to do medical intakes before sessions. Two good ones that spring to mind. 1. Client mentioned that her doctor was going to check her for diabetes. Me. Does diabetes run in your family? Client. No, but my mom has it and my dad has it. 2. Client mentioned in a relatively recent shoulder injury on her intake indicated no other previous surgeries or conditions. As I was finishing up the session with a scalp massage, my fingers fell into a big divot in her head. Me. Did you possibly have brain surgery at some point in your past? Client. Oh yeah, forgot to mention that. Story 118. Not a doctor, but was a patient's guest, i.e. my alcoholic, manic, depressive roommate. He came home after 1 a.m. so drunk he couldn't talk, turned off the movie I was watching, started unbuckling his belt. I stood up and said, "Please don't do that." And then voila! A 14-inch long gash 3 inches wide down his thigh that left his muscles in perfect condition. It was like a textbook anatomy cutaway image. Barely any blood. I took him to the ER ASAP. He told the doc he fell riding his bicycle in the rain and a sharp bicycle part somewhere must have cut through his pants and all the way through his skin. The intoxication seemed to resolve all 5 staff members' look of disbelief. The ER doc leaves, says she'll be back in 1 hour after she finished up with everyone since soldering a cut that size would take a while, and because she's solo. 6 hours later she comes back. brain trauma incident. The medical assistant starts cleaning up his leg, asks, "What were you writing again?" Patient repeats his BS, to which the MA replies, "Oh, because it looks like you have the outline of motorcycle motor engine casing seared into your calf below your cut." The burn from his motorcycle accident didn't show up until an hour or so after we got in, so the staff missed it the first time around. By this point, he was sober enough to want the pain meds, but too hungover cranky to fess up. With a raised brow, the doctor interrupted the MA and patient before any confession could be made, prescribed opiates for the giant second-degree burn, stitched up the cut, and that was that. Story 119. Patient walked into ER with rectal bleeding, so I performed an anal examination and felt something hard and metallic. Sir, what is it that you have in your rectum?" "Well, I wrapped some cocaine in aluminium and shoved it up my butt." Immediately rushed to my attending because if I had somehow accidentally opened it during the examination, he could die within minutes by an overdose. Luckily, all went well and we removed it via endoscopy. But to this day, I wonder why he would do this and then wonder why he was bleeding. Story 120. A close friend worked at a gynecologist office. She said a woman came in and she smelled so bad. The doctor saw her and asked her what happened. She said she was cleaning, heard a pop, and then felt pain. Apparently, her lady parts had been ripped open and her intestinal guts were coming out through her lady parts. The doctor said there was no way this could be physically possible by bending over. This was a trademark case of horse, or something similar, bestiality gone wrong. Story 121. Surgery resident here. Guy came in with a pink vibrator stuck in his rectum. Had to go to surgery to get it out. He wouldn't let us tell his wife, so she didn't know why we were taking him to surgery. We got it out through his anus, as opposed to having to open his abdomen. We told his wife she should discuss with her husband about what's going on. I don't know if he ever told her. We discharged him immediately after the procedure. A very awkward situation. Don't put stuff up your butt that you don't have a good grip on or a string attached to. It can get sucked up, and if it sits too long inside you, it can erode through the wall and spill stool inside your abdomen. Surgical emergency. Story 122. Not a doctor, but used to be the overnight answering service for a large doctor group, covering various specialists. We were not allowed to give medical advice. We could only contact the doctor on call. A woman called one night around 2 a.m. and she's talking very quietly. I ask her to speak up as I'm having trouble hearing her. She starts her story over again, stating that she's in the garage because she doesn't want her family to worry. She goes on to tell me that her intestines are hanging out of her rectum, and should she go to the ER? Against my training, I advised her she should definitely go to the ER and that I would contact her doctor ASAP. I was baffled that someone would call for advice on whether intestines no longer on the inside of your body was an emergency. Story 123. I heard this story from a friend of the person who is supposedly a nurse in an ER. I don't know if this story is true because of that, but it is an amazing story nonetheless. One night, a woman is carted by the EMTs, and she is so large she needed 2 stretchers. We are talking well over 500 pounds. The doctor comes over to her and asks, "What's wrong?" "Something is growing out of me." The doctor rolls his eyes and thinks, "Great, another hypochondriac." So he asks her where it is growing out of. She points down to her nether regions. The doctor puts her in stirrups. Don't ask me how, because I don't know, and parts her legs. Lo and behold, there was something green coming out of her lady bits. He stands up and goes to her and asks what she put up there. She denies anything, and reluctantly the doctor removes the foreign object to find it is a potato. That's right, a potato. He holds it up to her, and she was like, "Oh, that's right. I put that up there when I was on my period and I ran out of tampons. I forgot about that." You know, I'm not a woman, so I have no experience and I can't say for sure, but I'm just curious, are potatoes ever a suitable substitute for a tampon? Story 124. Not a doctor, but my mother told me a story about a guy who kept coming into their hospital with things shoved up his butt. After a while, it was getting annoying for the medical staff to see him on a monthly basis with some new foreign object in his rectum, and he became aware of their lack of enthusiasm towards his arrivals. So he came to the hospital one last time with a rolled up newspaper stuck up his butt so far and told the doctor, "Let me explain myself, doc. eventually moving on to say that he was bending down to pick up the paper in his bathrobe on his porch and that the paper boy threw an additional paper so hard and so on point it ended up in his butt. The doctor told him if he came back with something else in his butt, he would have to keep it there. Is this some sort of weird, twisted sitcom? You guys just don't seem as amped up as you used to be about unlodging things from my butt. Story 125. ER nurse here had a patient come in one day who said he thinks he has an infected chicken. The stench of this man confirmed some type of infection. The smell was so bad we needed to give him a single room. A doctor and I go in. Doctor to ask the questions, and I was there for moral support and to assess the wound. But mainly we were both there to support each other because we had the feeling it was going to be interesting. Tries to say he doesn't know what has happened. A few minutes pass and we decide to take a look. I am not going to describe it because it was horrendous. Can on request for all you sickos out there. But after a few more probing questions, we get this confession. Look, okay, it was the ice. Not me. It was the ice. It was a crazy drug. Me and my girl wanted to get kinky, so I got electrical tape and pulled my chicken out and wrapped the tape from base to tip as tight as I can. Then I got a candle, and I let the hot wax drip over my chicken, which kinda burned. And then I got the ink tube out of a pen and stuck it down my chicken. I took that out, but I ended up passing out with the tape still on my chicken and woke up the next morning. I pulled it off, but my chicken was burnt and really swollen and blistered, and I thought it might sort itself out. This was 5 days ago now, and it's only gotten worse. Doc, so why have you waited 5 days to come and see us? Patient, well, I was embarrassed, so I've been smoking a crapload of weed for the last 5 days to build up the courage. We get out, and the doctor turns to me and says, veteran doc here with so many years of ER experience, that is one of the strangest things I've ever seen. Story 126. Another guy came in for alcohol withdrawals and was meth positive. I work in the meth capital of America, so it's pretty common and I don't really think much of it. And most patients aren't really shy about it. But this guy was adamant that he doesn't do meth despite it fitting the picture. He's got the mouth, and his sister told me he disappears for long periods at times. He told me that he understands that he tested positive, but is convinced that the person testing his urine changed it. He wanted to find out who tested it so he can sue them. Story 127. Brother is a PA, so he told me this one. Had a teenage patient come in whose mom said she slipped and fell while showering, causing a shampoo bottle to go up her lady parts. My brother said, so you slipped in the bathtub, causing you to do the splits, and the bottle went inside you? And she agreed. Obviously, she was self-pleasuring with the shampoo bottle and went too far inside. With the mom there, my brother didn't press much after because she wanted to lie. Regardless, he said when they took the bottle out of her, it made that suction noise because it was buried that deep into her. Story 128. Pharmacist here had a patient show up in a community pharmacy asking about what topical product I would recommend for a rash. As in my practice, I inquired about size and potential causes. Patient proceeded to reveal a significant abscess on the left gluteal. Abscess was around 3 centimeters in diameter and had ruptured. Basically, I was looking at a hole in the skin that had progressed to the bone. Immediately wanted the patient to go to the ER a few blocks away. Instead, she demanded for a while that we debate topical solutions. Took a phone call to her physician and repeated concerns by myself and the other pharmacist on staff to get her to go in. Story 129. Saw a consult in the ED for abdominal pain. Patient initially chalked it up to bad Chinese food. I went through the usual list of questions about belly pain until, given the benefit of having seen his abdominal x-ray, I started probing about activities that may involve foreign bodies. He adamantly denied having inserted any objects in his anus until I showed him the x-ray that revealed a chisel in his rectum. He shrugged it off and said it had been there for 4 days. Apparently went on a bender and felt the need to get intimate with his hardware tools. He wasn't able to get it back out when he sobered up. Didn't want it removed as he felt there was no way this was contributing to his symptoms of lower abdominal pain and bloody discharge. We gotta pay doctors more. You know, there's so much removing of objects and dealing with crazy people. It sounds like that's so difficult on top of the actual laundry list of responsibilities they have. This is wild. Story 130. Thanks for the laughs today. As a home care aide, I see a lot of denial in my clients. One 62-year-old client of mine diabetic for 20 plus years, knows what she is supposed to eat or not. Lack of education on proper eating is no excuse. She's been to diabetes education enough times to probably teach it. Client, blood sugar low, I drank a Coke, all 12 ounces of it. Me, Coke is bad for you. Client, no it's not, it raised my blood sugar. Me, you were right, it did raise your blood sugar, but it will also make your crash harder and make your blood sugar readings worse off than when the sugar wears off than it was before you drank the Coke. Client, I didn't know that. And this is a woman who drinks 12 to 24 ounces of Coca-Cola a day, eats frozen burritos, considers a Mr. Goodbar and 8 ounces of soda lunch, and can't figure out why she's dizzy all the time and her blood sugar readings are almost always either below 100 or over 200, despite the whole world's best efforts to tell her differently. Story 131. Had a 21-year-old male presenting with right-sided weaknesses and slurred speech. Too dang young for a stroke. Sounds like a neurodisorder exacerbation. Consult neuro. Get a stat head CT just to satisfy stroke protocols. CT shows left-sided ischemia, differential of encephalitis. Blood work comes back, elevated troponin. 1.0 times, nothing too crazy. MRI confirms stroke. Patient also had type 2 MI. Ask patient if he's taken any drugs. Parents are in room. Patient denies. Tell him I need to get a U/A, and by U/A I mean a UDS. Drug screen comes back negative. I ask the parents to leave the room. Ask the patient what the F he took. Synthetic drugs? I then spend several minutes explaining to the patient why he's an effing idiot and how we never have people who smoke real marijuana present to the ED and end up with a stroke or get intubated or have heart attacks. Stick to the real crap, kids. Story 132. Not a doctor, but I had an odd experience when sharing a room in the cardiac ward a few years ago when I was 18 years old. I had been admitted because I was in hospital for what was thought to be a burst appendix, and they'd given me morphine and I had an anaphylactic reaction to it. Joy. Upon waking in the cardiac ward, I saw a man, age approximately 30 years old, getting out of the bed beside me to go to the bathroom. When he came out, he had changed from his hospital gown into a t-shirt and shorts. Without introducing himself or anything, he said, "Hi, I'm going to the gym," and left. I was pretty doped up and exhausted, so while I found it strange, I didn't think much of it. I actually didn't even know I was in the cardiac ward yet, as I hadn't spoken to any nurses or anything. I continued to fall in and out of sleep, and soon after, when my nurse came to check on me, she began to panic when she noticed my roommate missing. She woke me from my hazy sleep and asked me where the man had gone, to which I groggily replied, "He got changed and said he was going to the gym." The nurse looked horrified, and suddenly I was surrounded by multiple staff members asking dopey me, who was very confused, what happened to the man. They quickly found him trying to leave the hospital, saying that he needed to go to the gym. Turns out he'd just had open heart surgery, hence being my cardiac ward buddy. I also remember him later trying to get out of his bed and attempting to take off his bandages, which resulted in blood spraying onto one of the nurses. All in all, it was a weird time. Story 133. I'm not a doctor, however, I'm a patient who hid something very stupidly. Back in February 2014, 22-year-old me was working on my car. Sitting in the driver's seat, I had the dash taken apart so I could replace the hazard switch. I felt the aura coming that always happens before a seizure. I figured I'd be okay because I was sitting down and pretty secure. When I came back to consciousness, I was in the most pain of my life. My back was in so much pain that I wanted to die right then and there every time I moved the slightest, and it only got worse. I have a problem. Mentally, I tell myself that I'm a burden on everyone and I need to do everything myself, so I did the best thing I could think of. I tried getting out of the car by myself for 15 minutes. I got one foot out of the car. I ended up texting my best friend's mom to come help me walk inside. Now, before I start telling you about the hiding part, I have to tell you, every time I have a seizure, I can't remember stuff. My brain just glitches. It's rebooting. One seizure, I forgot the whole previous day. One time I looked at my friend and told her I didn't know who she was. It freaking sucks. But anyway, my friend's mom was my roommate. I didn't know what just happened. I didn't know why my car was taken apart. After I failed to get out, I remembered that I was working on my car, but I still didn't know what happened or why my back hurt. I told her that I was just so tired that I took a nap and woke up and think I had a kink in my back. I just needed her help to walk me in. She got out there, tried to help me out. I screamed in pain. She asked me if I wanted her to take me to the hospital. I stupidly said, "No, I'll be fine. I just want to lie down." I really just didn't want to interrupt her day off and having to sit in the ER. She finally was able to help me get inside and get in my bed. I asked her to turn the light off and I tried to go to sleep. There was so much pain coming from my back, I'm in tears. Breathing is no longer something I want to do as it just causes me pain. As I'm lying there, I'm just thinking, and then it clicked. I had a seizure, but I can't tell people that because then I can't drive, and other people have to drive me to the doctor visits and to work and wherever else. I can't be a burden on these people's lives like that. I had to ask her to take me. The pain was too much. Getting out of my bed, down the stairs, and into her car took longer than it ever should have. Well, now that I'm in the ER, she has to get my whole family involved, and it doesn't help that my cousin was working that day either. Told everyone that I fell asleep and woke up and was just hurting. The doctor probably dismissed me as a druggie and just gave me the Loratabs to keep me happy. Then I was discharged. Fast forward a couple months. My sister is tired of me being in pain, makes me go to the doctor. I get x-rays done. It turns out that during the seizure, I had fractured some vertebrae in my spine. Later, arthritis set in, so I came clean. My sister told me she was disappointed and I felt like crap. Made her a promise to never hide anything relating to my health from her again. I know it was dumb to hide the fact that I had a seizure, and I've learned since then. That sucks so much. I mean, to genuinely need help, but to you care about inconveniencing people to the point where you're really in danger. And also, if you are driving or you're doing things on your own and people don't know, it can also be a danger and it can be reckless to other people. But yeah, it's such a hard spot to feel like you got to take on the whole world on your own, especially in a bad position like that. So I'm glad that the family knows about it now, and hopefully people are stepping up and taking care of the guy. And if anyone else is in a position like that, just sometimes you got to burden people. Sometimes you just have to ask for help. Way easier said than done, I know, but you deserve help. Story 134. I was helping the primary nurse settle a patient in for their admission. The patient was alert, oriented, and pretty pleasant considering that her systolic blood pressure was somewhere in the 70s at most, and she was pretty debilitated from various chronic illnesses. CHF, DM, CKD, PVD, some type of cancer? Her admitting diagnosis, though, was severe sepsis. We were performing our routine skincare assessment for new patients. We noted the usual skincare wounds, such as non-healing ulcers on her lower extremities. However, it was when we turned to the patient that we realized something unusual. There seemed to be a small nest of something wriggling in white under her. When we turned her back around, we noticed the source of what we identified as larvae or bugs coming out of her lady parts. This was perhaps one of the most bizarre moments of my life, my team of nurses, and I think the attendings as well. The sad thing is that we're pretty sure she was aware of this issue because she seems unsurprised when we asked her about it. However, due to her debility, she was unable to address it herself and was simply too embarrassed to bring it up. Unfortunately, this patient did not survive. I think this moment illustrates to me how, even when critically ill, our patients still try to hide things from people trying to help them, perhaps to maintain some semblance of privacy or dignity. It also taught us how important an assessment can be. Story 135. I was a med student. I was in the ED stitching up this dude's arm, which had this 9 to 12 inch laceration, which was a good inch or so deep. He was drunk, so much that we did not need to use any local anesthetic for the stitching. He claimed he had walked into a glass door. Ends up, his girlfriend was defending herself against his drunken rage. I heard this from one of my surgery friend interns. I forgot why the patient was in the hospital, but the patient was post-op with a wound vac on. Patient had a wound dehiscence and is emergently brought back to the OR. Ends up that when the emergency was called, the patient was having relations with his girlfriend and the girl was standing in the room in a towel after calling for help. I think they had to put some sort of restraining order against the girlfriend so it wouldn't happen again. Story 136. Middle-aged patient came in after having a seizure. Denied any history of seizures but said he recently had brain cancer diagnosed. Labs come back showing hyponatremia. Can't remember his heme-oncologist's name, saying it was a long Indian-sounding one outside of our system. Do CT, which is unremarkable. Do MRI, unremarkable. Consult oncologist, they have no idea what's going on. We keep getting pieces of the story. He says he had radiation and that it all cleared up. Consult neuro. They have no idea what's up. Starting to consider further diagnostics when this dude goes into status epilepticus. transfer him to the ICU. When he comes out of it, he admits to us he is actually an alcoholic and has never had brain cancer or any cancer. Guy's wife loses her crap and storms out because even she thought he had brain cancer. Guy basically convinced all of us and his family, apparently, until he was full-blown DTs. He is lucky he didn't die. Story 137. The number of things people put in their rectum never ceases to amaze me. I have seen Tabasco bottle, gerbil, various vegetables, a pepper shaker, and others I'm sure I am forgetting. I think the best one was a male PT 65-year-old diabetic, blind with a slew of other medical problems, came into the ED, chief complaint of personal problem. From the bat, you know this is going to be interesting. The PT refused to take a seat, finally told me that him and his partner had been fooling around and they got the toy up his rectum, but were unable to retrieve it. Got the abdominal x-ray and turns out the 9-inch dildo and the 5 inches of handle flange had made into and beyond the furthest reaches of his large intestine, sigmoid. He asked if I could get it out. He went to the OR where they removed it. Story 138. I have actually used medical-grade bugs to help biologically clean a wound for polymyalgia rheumatica. Physical disruption of those wounds can sometimes just make it worse. The bugs help clear away the dead tissue without increasing the surrounding inflammation. The only problem is keeping them on the wound and then getting rid of them 72 hours later before they pupate into flies. Unfortunately, regular housefly bugs that you see in your trash have a certain higher potential for spreading disease, and the flies they pupate into can bite and make even more of a mess. Story 139. My cousin, Dr. Cousin, was an ER doc for years. This story is from the early 1990s. One of the weirdest he mentioned was the really bizarre drugged-out guy that they had brought in with a bump on his arm after they'd had to subdue the guy. This was a long time back before tasers were out. Anyway, they'd hit the guy multiple times with the beanbag rounds from 12-gauge shotguns. From what the officer said, he was a really train wreck to fight, and the guy was a complete douche to all of the nurses and staff. Cousin eventually got to the point of, "You yell at anyone else, we aren't helping you anymore." 30 seconds later, "F you, Doc," over and over. So guy had a big lump on one arm, almost up towards the elbow. Small cut on the inside of his wrist, bump was on the top of his arm. Dr. Cousin had him x-rayed. Turned out to be one of the bean bags had hit him on the inside of his wrist, gone under the skin and traveled up over the top of the bone and on top of the arm. Surgery to remove the bean bag. I have no clue how many code brown he ever had to deal with, but he was pretty happy to get out of the ER side of practice. Story 40. Not a doctor, but I heard a story. A patient comes in asking for Viagra. He completely blows off his blood pressure and diabetes. He says he's been having difficulty getting it up, and very recently he's been having pain in his nutsack. Doctor gloves up and checks. 1 testicle, 2 testicle, 3 testicles. There's a third mass in the sac. This is a real concern, so more in-depth questions are being asked. The patient innocently proclaims he has no idea, but helpfully suggests that Viagra might help. The doctor palpates the mass again and doesn't quite understand the F is hanging out in this guy's sac. It feels more like an object rather than, say, a tumor, hernia, or something else of biological nature. So they do an x-ray and it just gets more and more confusing. The mass appears to be a coiled piece of metal. The patient continued to feign ignorance as to why there might be a coiled piece of metal in his nutsack. The doctor tells him that until they figure out what this thing is, he's going to withhold his Viagra. Intercourse activity could be dangerous for him. Finally, the patient spills the beans. He really has been having erectile dysfunction, and he and his wife have been trying everything to solve it. His wife is just crazy for relations. Lately, they had started inserting things into his urethra to keep his chicken up enough for them to get it on. At some point, they tried inserting pipe cleaners. Those fuzzy metal ones, not the Drano kind of pipe cleaner. They gradually inserted more and more pipe cleaners to improve his hardness. He guesses that during this, pipe cleaner was pushed way in and they lost track of it, and after many times having relations, it gradually pushed it into the sac, coiling up. The doctor was flabbergasted because anatomically it makes no sense. It would have had to have been burrowed through flesh to get to the sac, and it would have been painful the whole time. How did the patient live like that for so long as the thing was working its way in there? The patient just shrugged it off and said his wife really loves the intercourse. They referred him to a specialist to have the thing removed, and that was the last they heard of him. The doctor to this day is not convinced he got the whole story. Story 141. I'll never forget the English patient we had years ago. He came in full black chainmail and a helmet. Both arms and legs had been amputated during some sort of altercation, yet he barely bled. We had to call in security to hold him down until we could administer some medication to calm him. The crazy guy kept yelling, "It's just a flesh wound!" and that this was all that a-hole Arthur's fault. Perhaps they should consult with the knights that say, "Eki, eki, eki, patang, zumbai." Story 142. My best story was from an ER. Guy comes in with a wire hanger up his butt. Won't say why or how it got there. Girlfriend comes to visit and it all comes out. He's older. She's much, much younger. He wanted to please her by standing at attention properly. Inserted hanger, sharp edges first, and then it got stuck. So he rode his bike to the ER. After removal and a quick visit from the cameraman, he went home with antibiotics and some Viagra. He came back about 6 months later, same dilemma. Story 143. Kind of not really related, but my mother worked for a private mental hospital that specialized in high-functioning drug addicts. Yes, including cannabis. Commonly, but not erroneously believed to be non-addictive. Patients were not allowed to take their recreational drugs into the hospital, but they smuggled them in and hid them in the rooms. I have to admire their ingenuity. They would manage to take the light fittings off the ceilings, hide their drugs in the roof, then reattach the light fitting. The nurses knew to look there and would usually kick the patient out, and the patients would usually complain that they didn't see what was wrong with hiding illegal drugs in the hospital while being treated for drug-related mental health problems. Really, folks, don't do drugs. Story 144. My mom told me this years ago after working in A&E. A man had come in with third-degree burns to his anus and surrounding area. After an hour or so, they managed to get out his partner exactly what happened. They had decided to try felching. The hamster had gotten lost, so he'd gone to look for the rodent using a lighter. The methane had caught fire, set alight the hamster, and burnt all of his partner's insides. They had to extract the now dead hamster from the guy and treat him for burns. I bet they never tried that again. Not the animals, guys. Stop with the animals. Story 145. Christ, doctors are stupid. If you keep asking a question and not getting the proper response, why not trying to ask a different question, you morons? Have you ever had surgery? What meds do you take and why? When was the last time you saw a doctor? Have you ever spent the night in a hospital? Of course, doctors don't want to spend more than 3 minutes with you, so they ask their one question, and if you don't answer correctly, they move on. Oh well, patient's fault. Every arrogant doctor I meet, I remind him that modern plumbing has saved tens, if not hundreds, millions more lives than modern medicine ever will. Well, that was an interesting last take.